The views, information, and opinions expressed during the following program are solely those of the individuals involved and do not necessarily represent the views of Access Communications, its representatives, or its employees. Live debate coverage is brought to you by the Saskatchewan Realtors Association, the Regina and Region Home Builders Association, the Regina Hotel Association, and APAS.
Good evening and welcome to Decision 2024, Our Province, Our Vote. My name is Lisa Peters and I will be your moderator for these debates. This evening is brought to you by the Saskatchewan Realtors Association, the Regina and Region Home Builders Association, the Regina Hotel Association, AccessNow TV, and the Regina and District Chamber of Commerce. In preparation for this evening's debate, draws were made for opening comments, closing comments, and podium position. Our topic for tonight's debate will be healthcare. I would now like to introduce you to our candidates for this evening's debate. At podium 1, we have Rose Bushall, Progressive Conservative Party of Saskatchewan. Podium 2, we have Remy Rowe, Saskatchewan Green Party. Podium 3, we have Everett Hindley, Saskatchewan Party. And at podium 4, Jared Clark, Saskatchewan NDP. We will now go to our opening comments while each candidate is given 2.5 minutes to speak. Our first opening comment will go to Everett Hindley.
Thanks, Lisa, and thanks to my fellow candidates for being here this evening. I want to begin by thanking every healthcare worker in Saskatchewan for looking after the well-being of our families, our friends, and our neighbors right across this great province. We know that there are challenges in healthcare today, but we are committed to meeting those challenges. This year's Saskatchewan budget delivers the largest ever increase in healthcare spending, $7.59 billion, up 10.6% over the previous year's budget. The budget is expanding patient care and services to meet the increasing demand of a growing population in this province. There is $3.5 million of an increase for breast cancer care and screening initiatives that include a new breast health center here in the city of Regina. We are investing $1 million for important research into ovarian cancer. We've increased funding by $30 million for the capacity pressure action plans for Regina and Saskatoon to address some of the pressures on our hospitals and our biggest centers. We've also launched the Health Human Resources Action Plan to recruit, train, incentivize, and retain healthcare workers in our province. The Saskatchewan Party government has invested over $300 million into this plan since 2022. Our plan is working. About 400 internationally educated nurses have arrived from the Philippines and to Saskatchewan, with 280 now working in hard and to recruit positions in 70 communities across the province. We've hired 1,400 nursing graduates from Saskatchewan and other provinces in Canada. We've added 870 new training seats across 33 healthcare designations and various programs at post-secondary institutions. But these types of investments are only possible through a strong and growing economy. Under the Saskatchewan Party, our province is experiencing record growth. More jobs, more people, more opportunity. But it's not just growth for the sake of growth. It's so we can make these important investments into areas like healthcare. This means our election comes down, and this election comes down to a very simple question. Which party has the plan to keep our economy strong and our future bright? Tonight, we'll have an opportunity to compare plans and compare records. And a re-elected Saskatchewan Party government will have a plan to keep our economy strong and our future bright. Thank you.
Thank you, Mr. Hindley. And to you, Ms. Bushell, you have 2.5 minutes.
Good evening, and thank you again for having me back. In the past 17 years, we have seen our healthcare system rapidly decline. The province has seen cut after cut, and doctors and nurses leaving the province for better opportunities. Let's face it, our Saskatchewan healthcare system is in critical condition. The Sask Party talks about putting more money into healthcare, building more hospitals. But if we don't have the staff to run these facilities, these will be vacant buildings or constantly put on bypass like many of our rural facilities. In 2023 and 2024, they boasted an increase of funding to healthcare. But what they failed to mention was $61 million of that money was actually promises made from the federal government. This was not all Saskatchewan's dollars that they took credit for. They don't mention this because they don't want you to know the whole story. They don't want you to know the story about AIMS and how nurses are not getting paid for over 5 weeks, or how hospitals are running out of oxygen because the AIMS program does not work, or how AIMS was budgeted first to be roughly 84 million and now it is a balloon to over 240 million. This is what the Sask Party and an ineffective opposition have done to our healthcare system in the past 17 years. We need a strong voice in the legislature and with the progressive conservative candidates to advocate for quality and sustainable healthcare system. A healthcare system where privatization is not part of this conversation.
Thank you, Ms. Bushell. To you, Mr. Clark, you have 2.5 minutes.
Thank you very much. Good evening, everyone, and it's a pleasure to be here with you this evening. Members of my team, the Saskatchewan New Democrats, and I have been knocking on thousands of doors over the past few months, listening to voters and listening and hearing the people around the issues that are most important to them. Problems in the healthcare sector are far and above the #1 issue for people this election. Wait lists are some of the longest in Saskatchewan out of all the country. 1 in 6 Saskatchewan people doesn't have access to a family doctor. Emergency rooms are being closed without proper notice all over rural Saskatchewan. There hasn't been a day in the last 5 years where an emergency room in Saskatchewan hasn't been closed due to lack of staff. Those ERs that remain open are sometimes running at 3 times over capacity. People in this province are scared, and who would blame them? Those who get into hospital are being put in a bed in a hallway. It's a nightmare. The very least you deserve is that on one of the scariest days possibly in your life, you should deserve a little bit of privacy. Nothing about the situation in Saskatchewan's healthcare system is okay. You know that. Saskatchewan New Democrats know that. Scott Moe and the Sask Party broke healthcare. We cannot trust them to fix it. Carla Beck and the Saskatchewan NDP are going to get our healthcare system back on track so that people can get healthcare before it's too late. So our nurses and doctors don't feel so overworked and disrespected that they pack up and leave the province. So the Sask Party can't sell our hospitals and our healthcare system to the highest bidder. Saskatchewan, it's time to get out of last place when it comes to healthcare in this country. It's time for a change. Thank you.
Thank you, Mr. Clark. And to you, Mr. Rowe, you have 2.5 minutes.
Chimigwich, thank you. Merci everyone for being here with us and joining us on Treaty 4 territory. This is an important situation, not just for non-Indigenous peoples, but also for our First People of Turtle Island. This becomes an issue when there are problems within the medical system that can be addressed. We centralize it and then we take away the transportation. We hit the most vulnerable people at the most vulnerable times of their lives when they are sick. The medical system today, and I know because personally I have fought Saskatchewan Health for 22 years on behalf of my mother. They have left her desolated. They left her isolated. They left her in positions that were not even considered humane. If humanity cannot prevail in our medical system, then humanity fails. It is time for real change, reallocation of funds, and allowing the medical system to look after people, because that's what and who we are. We are people first, not profits. We are people first, not anything else. I love the concepts of what the other candidates have mentioned about expanding hospitals and everything else, but have you noticed they've always been only in the urban centers? Our medical in the rural areas, such as where I am actually running in Moosomin and Montmartre, Our hospitals are on bypass constantly. You get sick, they have to ship you. They can't attend to you right there. This is a problem. We should have medical facilities within a certain parameter where there are people. Even if you have one doctor, one nurse for every 2 or 3 communities, you should be able to get to them within 20 minutes. You have 20 minutes. And I like to say to every party that has run and has won in the past, your 20 minutes are up.
Thank you, Mr. Rowe. All right, candidates, we are now going to move to the debate part of our, the questions part of our debate. The topic is health care. Now, our first question has been recorded in advance by Bill Probilski of the Agricultural Producers Association of Saskatchewan. Let's have a listen.
Access to healthcare is essential for the well-being of Saskatchewan's rural communities, which are the backbone of the province's agricultural sector. How will you address healthcare shortages in rural areas to ensure that farmers, ranchers, and their families have access to the medical services they need to stay healthy and productive?
All right, thank you. The first question will go to Ms. Bushell.
Thank you. So we have put out a very extensive plan when it comes to Saskatchewan healthcare, especially involving rural access. We are not utilizing what our resources wisely. We've got over 40% of registered nurse practitioners that are not working in that capacity. We have emergency rooms that are being put on bypass, so they have to travel to the next town or possibly city. We can actually use these nurse practitioners in the hospitals for that initial point of contact, because most times, and hopefully most times, it does not require a visit to a bigger center. By doing this, we are now being able to revitalize rural healthcare in a way that all people can get access. It is a way for seniors that they don't have to travel for large cities to renew prescriptions, and that way it will take down the burden of emergency rooms and clinics within larger centers and keep people at home.
Thank you, Ms. Bushell. To you, Mr. Rowe, you have 1 minute.
So again, when we're talking about rural Saskatchewan and being in the Grettenfeld, our facilities out there are basically non-existent. So again, we're going to talk about refunding the rural communities, bringing medical professionals into the areas that they need to be. Emergency services, you know, it's not just about going over there and saying, oh, I need a Band-Aid. I need stitches. You know, we've got to start looking at how we can actually bring these services back to where they should be and where they were before a lot of the previous governments, whether it be NDP or whether it be PC or even right now the SAS party. It's time to actually change things, get back to basics, bring back care and compassion. Life is a diamond. We need to start looking at the point of the diamond to see how faceted we can be.
Thank you, Mr. Rowe. Mr. Hindley, you have 1 minute.
Thanks, Lisa. Our HHR action plan that our Saskatchewan party government announced a couple of years ago, September of 2022, has focused on a number of key areas for us and focusing a lot on rural Saskatchewan, remote areas, 250 new permanent full-time enhanced positions in rural communities. That's something that I heard as the Minister of Rural and Remote Health at the time, going around asking frontline healthcare workers, and we're grateful for the service they provide, but asking them what it was that they needed, and they needed more staff on the front lines. So we've had dozens of communities across this province benefit from the rural incentives to try and recruit healthcare workers into rural communities. Secondly, in this year's budget, we announced 27 new positions for nurse practitioners across this province. Positions are posted. A number of them are being filled already, and that is going to have a significant impact on our rural communities as well. And I'd also say expansion of scope of practice for whether it's nurse practitioners, pharmacists, paramedics, allowing those healthcare providers who are trained to do that work to be able to do it in rural communities.
Thank you, Mr. Hindley. To you, Mr. Clark, you have 1 minute.
Thank you so much. You know, people all across Saskatchewan deserve to have health care there for them when they need it, and this applies especially in rural Saskatchewan. Unfortunately, under the Sask Party, what we have seen over the last 5 years is there's been 4,000 days in this province where emergency services in communities across the province have been closed because of lack of staffing. This government cannot retain healthcare workers. We've seen 21% of rural and remote nurses leave the profession over the last 5 years, and this falls at the feet of the Sask Party government. We have a number of solutions to turn this around. One is that we're going to start by listening to frontline healthcare workers. For example, 400 nurses on the steps of the legislature last week were calling on the government for them to be heard, for their solutions to be heard. And the Sask Party didn't even show up. So we want to start by listening to healthcare professionals, also turning a number of part-time casual job postings that we see in rural Saskatchewan into permanent full-time positions, hiring more nurses, hiring more doctors.
Thank you, Mr. Clark. We are on to our second question. We're going to talk about wait times. How do you plan to address long wait times for medical procedures and specialist appointments in Saskatchewan? First question will go to you, Mr. Rowe. You have 1 minute.
So wait times, you know, if we had the facilities that we could actually turn around and help people, we wouldn't have the wait times that we have. I'll give you a prime example. Like I said, I've been fighting Saskatchewan Health for 22 years. There was a time where my mother had to wait 19 hours in a waiting room. My mother's a 4-time cancer survivor. She just passed away in February, and she had to pass away in a room alone. So when we start talking about humanity, we have to stop putting dollar figures onto it. Life is life. When we look at our lives and how they actually start and how they end, it is a way of dying with dignity. It is a way of living with dignity. And it does not account for 19 hours of waiting in a waiting room to go and see a nurse.
Thank you, Mr. Rowe. Mr. Hindley, you have 1 minute.
Thank you. We have hired in the past couple of years over 200 new physicians. That includes specialists such as surgeons to this province. We've made record investments into our surgical wait time initiatives here in Saskatchewan, reducing the surgical wait times and the number of people waiting for surgeries in this province. We're grateful for the surgeons, the healthcare teams, the nurses that support those teams to make sure that we can get these surgeries done, and so the patients get them done on a timely basis. We've been working to reduce that surgical wait list that ballooned during the pandemic, as it did in many other jurisdictions across the country. In our case here in Saskatchewan, up to 35,000 people waiting for surgery. We've now reduced that number significantly. And in the past fiscal year had nearly 96,000 surgeries completed, a record number of surgeries completed in Saskatchewan, which is building on a previous record number of surgical procedures completed in our province. We're committed to continuing to invest into our surgical teams and looking at all of our options to be able to get people the surgeries they need when they need them.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. As I said before, you know, people in this province deserve to have health care when and where they need it. Today on the doorstep had a conversation with a woman who went to the ER in pain and sat there for 9 hours. Went up to talk to the triage nurse and then was told she's probably going to wait another 9 hours. So she went home without getting the care that she needed on that day. Whether we're talking about waiting times in ERs, whether we're talking about waiting times for mammograms in this province, talking to a woman on the doorstep just the other day. In Regina, we're booking, the clinic for booking mammograms is booking into December of 2025. These are unacceptable results. Results matter. Our team is committed to turning this around, investing an additional $1.1 billion into healthcare, making sure that we get out of last place when it comes to knee and hip replacements, and especially those mammograms. Sending them to Calgary is not the solution. We're going to invest in public healthcare in this province by hiring more nurses, hiring more doctors, hiring more technicians. Thank you.
Thank you, Mr. Clark. Ms. Bushell.
Thank you. How do we reduce wait times? Well, the first thing we have to do is we need to restore and revitalize rural health care. City hospitals and clinics are being overburdened by people having to travel long distances for something that they could be treated for in their own community. This shouldn't be. Not only does it put a burden on rural healthcare or urban healthcare settings, What it also does, it makes things more hazardous for the person going to these centers for any kind of emergency. This is because weather conditions in the wintertime especially, now you have seniors that are relying on rides, when sometimes all they need is their prescription refilled. This is something that can't continue to happen. We can utilize existing resources, which is something that I'm really glad the Sask Party has been reading our policy and is learning to adopt, as you heard from the previous question. And we will furthermore open up more training spots in the province for healthcare workers with a percentage reserved for people who are born and raised in Saskatchewan.
Thank you, Ms. Bushell. We will move on to our third question. We're going to talk about mental health services. What initiatives will you implement to enhance mental health services and support for residents? The first question will go to you, Mr. Hindley. You have 1 minute.
Thanks, Lisa. This is an issue that our government is taking very seriously here in this province. And we're seeing this right across Canada, growing in mental health and addictions concerns. We've been investing year over year record investments into our mental health and addictions strategies and action plan. Most recently, and there's a number of initiatives within that action plan, but most recently we've been working to make sure that we're enhancing access to addictions treatment beds, adding 500 more addictions treatment spaces in this province so that when people who are struggling with a life of addictions and are looking for help, that they have access to that. And well over 200 of those spaces are already now open and available in this province. Additionally, something else we're doing is working very closely with our partners at Family Services Saskatchewan to create a number of mental health free walk-in clinics supporting people right across this province so that they have that immediate access to mental health. Those are just a couple of the initiatives that we've been pursuing, but there's more work we're going to continue to do.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. You know, at this point in Saskatchewan and across Canada, we all know someone who has been struggling with mental health or addictions, and we know people who have been lost to the toxic drug overdose crisis. Year after year, we have set records in this province of the number of people who have died, and the Sask Party has frankly dragged its feet on things like suicide prevention. You know, it took 3 times for my colleague Doyle Vermette for his private member's bill on suicide prevention to be voted on and accepted in the legislature. And after that 3rd time, the Sask Party finally said, yes, we're gonna pass this after he worked so hard after talking to so many families. But since then, they haven't fulfilled the spirit and intent of that legislation, and we haven't seen the supports there for people. We're going to increase access to mental health and addiction services across the province when people need it.
Thank you, Mr. Clark. Ms. Bushell, you have 1 minute.
The biggest thing when it comes to mental health is being able to recognize it early enough. And the problem is it's not happening. The reason why it isn't happening is because of all the cuts within the education system. Currently, we have 1 psychologist per every 2,995 students. The wait time to see somebody is now 2 years. By the time anybody gets any kind of treatment for that early detection, they are now aged out and graduated from high school. These are the very people who end up on the street. These are the people who will sometimes struggle with addiction. If we start in the schools first and start educating people early, watching and recognizing those signs, we will lose a lot less people due to mental health incidences and drug overdoses.
Thank you, Ms. Bushell. To you, Mr. Rowe, 1 minute.
Okay, mental health. Boy, oh boy, that's a big topic. First of all, cutbacks to SARC didn't help. We have to turn around and we have to identify it early. We have to be able to sit down. And you know, mental health is not always drug addictions. You're talking to a drug addict that's been 39 years clean. It's not about mental health. It's about coping with society and the downfalls of what the government has done in the past to bring us to this point right now. We need to turn around and remove the trauma. We need to address the trauma that is happening within our Indigenous First Nations people. We need to help with the traumas and the struggles that our children are going through. We need to be able to listen to the professionals, to work with them, and to keep us informed as to what's going on. because it is the only way we can actually create better policies to address the issues and help people in the future.
Thank you, Mr. Rowe. We'll move on to our fourth question about funding and resources. How will you ensure adequate funding for healthcare facilities and services to meet the growing needs of our population? Question first will go to you, Mr. Clark. 1 minute.
Absolutely. Thank you for the question. Saskatchewan New Democrats are committed to making serious investments in healthcare over the next 4 years. We have committed to an additional $1.1 billion into the healthcare system and really looking to make sure that we are listening to frontline health care workers. That is the key in terms of understanding where improvements can be made in the system. Frontline healthcare workers have the solutions. They're the ones on the front lines. They know where the pinch points are. They know what can turn the ship around. We're prepared to work directly with nurses, with healthcare workers, with doctors, through a nursing task force, through a healthcare task force to make sure that we are making sure healthcare is there for Saskatchewan people.
Thank you, Mr. Clark. To you, Ms. Bushell. 1 minute.
Thank you. So funding for the healthcare in the province. We do have the funding in the province of Saskatchewan. What we don't have is good management of the funding. We currently have a government in place that likes to spend like the federal Liberals. They spend it on vanity projects that are not needed, projects that are not properly researched. So when it comes to funding for healthcare, the money is there. We just need to be more fiscally responsible and use it more wisely.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
So we talk about funding. First of all, we need to reduce administrative burdens in healthcare. We actually have to reallocate that money. We pay a lot in taxes. Everybody pays a lot in taxes. Why are we not making sure that our tax dollars are being used properly? You want to make a big project, that's fine, go ahead. You want to put SMRs and pollute the water, put it in your backyard. No SMRs because it's going to destroy the water system. 70% of the water being fed into Saskatchewan homes comes from Lake Diefenbaker. We got to stop spending money foolishly and start being held accountable and responsible to the people that give us this job. This is a job. This isn't about just making money and representing somebody else. This is a job, and we need to be held accountable for it.
Thank you, Mr. Rowe. Mr. Hindley, you have 1 minute.
Well, we're going to continue to make significant investments into healthcare. I said in my opening remarks, I talked about the $7.6 billion into healthcare in this year's budget, whether that's capital projects, and we have a number of significant projects underway right now, plus many across the province over the past number of years since we've had the honor of forming government. Over 15 long-term care facilities, new long-term care facilities are now under construction in La Ronge and Grenfell and Watson, or will be soon under construction. New hospital underway in Weyburn right now, plus a brand new tower, Prince Albert Victoria Hospital, serving not just Prince Albert, but also the surrounding communities in all of northern Saskatchewan. That's a significant project. Plus the urgent care center that recently opened here in Regina, that's seeing upwards of 100 plus patients a day, giving patients another avenue towards healthcare access here in the capital city. In addition to that, though, we're going to keep investing into the healthcare workers. You can't have a healthcare system without the healthcare workers. We've committed money to more healthcare positions across this province. We're going to continue to do so in consultations with the workers that we speak with.
Thank you, Mr. Hindley. Well, you're on to our next question. It is recruitment and retention. What strategies will you employ to attract and retain healthcare professionals, including doctors and nurses in the province? This first question will go to you, Ms. Bushell.
Thank you for the question. When looking at our healthcare system that we currently have right now in the province, one of the biggest things that we have a problem with is doctors and nurses and the shortages within them. This isn't because they don't come to the province. This is because they come here and then quickly leave after they filled a contract. This is because they're not getting paid per services the way they are in other provinces. So they're leaving for better opportunities. One thing we need to start doing is addressing the wage disparity between doctors here and doctors in other provinces. We need to bring that amount up to make it comparable, but also by calculating cost of living, to make sure that our doctors want to stay here in Saskatchewan. We cannot currently keep in the state where they're constantly leaving. We need them to stay, and the only way we're going to do that is by paying them what they're worth. Right now, the Sask Party and an ineffective NDP do not pay our doctors what they're worth.
Thank you, Ms. Bushell. To you, Mr. Rowe, you have 1 minute.
Retention and bringing people in. Well, you know, when we talk about health care, we always seem to focus on the patients. How about we focus on the workers? If your workforce is in a toxic environment, not being paid properly and being overworked and overburdened, of course they're going to leave. We need to readdress this issue to ensure that they have time for family, they have time for recreation, and they have time for work. This concept of bringing people in for a 12-hour shift and then making them work 16 hours because of the fact you're short-staffed is wrong. You interfere with the natural evolution of people. They need their rest. I feel for them. I've seen them sit in hallways crying because of the fact they didn't have enough time to spend with a certain patient. These doctor's appointments that are 3.5 minutes long does not give you an opportunity to...
Mr. Rowe.
Sorry.
All right. Mr. Hindley, you have 1 minute.
Thanks, Lisa. I've talked a bit about some of the work we're doing to recruit and retain healthcare workers like nurses, like care aides, like paramedics and nurse practitioners in this province. When it comes to doctors, earlier this year we recently signed a new agreement with the Saskatchewan Medical Association, which represents family physicians in this province, one that we worked very closely with our partners at the SMA to make sure that we have a contract for doctors that is competitive with those across Western Canada. And I would say that by and large it is, and we're doing some excellent work with our family physicians in this province. Other work that's happened as well, the Rural Physician Incentive Program that has been increased to $200,000 over a 5-year return for service agreement in this province. We've had over 300 applicants for that, far surpassing the goal of 140, I think, that we had initially had, or maybe even less than that for this particular program. There is interest in working in this province. There is interest in making sure that physicians and healthcare workers take positions, and they take them long term, so they're staying in these communities on a long-term basis to serve the people that in the communities that they live in.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. You know, the well-being of healthcare workers in this province is critical. And right now we hear from them that they feel disrespected and undervalued by the current Sask Party government. Nurses, doctors, healthcare professionals, they deserve better. But we're losing more and more healthcare workers every day. The Sask Party talks about how many nurses and doctors they are bringing in and hiring, but they never talk about how many nurses or doctors are leaving at the exact same time. We hear from nurses that retention is not something that is discussed with or by the government. That's why we are wanting to work with healthcare workers, developing a nursing task force that Sun has been calling for years, something that the Sask Party government 4 days before the election decided that they were on board with after 2 years of saying they didn't want anything to do with it. We would, again, move the positions in rural Saskatchewan from permanent or from casual and part-time work to permanent positions. Thank you.
Thank you, Mr. Clark. All right, well, it is time for me to stop asking questions and allow you to ask each other questions. We are now going into our candidate-to-candidate questions. Each candidate will be given 20 seconds to ask a question to whomever they choose. The candidate that has been asked the question will have 40 seconds to respond. The first candidate-to-candidate question will go to you, Mr. Rowe.
I'm sorry, I'm really bad with names, so I'm actually coming over right to the Sask Party right away. Okay? What are your plans to actually tackle the health care that has been oppressed to the First People of Turtle Island and to the people that live on reserves? They have been isolated because the Sask Party has removed STC.
Thank you, Mr. Rowe. Mr. Hindley.
Yeah, and thanks for the question. You know, I would speak towards some of the work that we're doing and the collaboration that we're doing with our First Nations and Métis partners when it comes to healthcare. You know, for example, working very closely with our First Nations partners with the Takakoop Cree Nation on the Urgent Care Centre in Saskatoon. That's a significant project, one that will have First Nations partners, and that's going to be critical for us. Secondly, work that's being done with the Chief Darcy Bear in Whitecap, Dakota on a virtual health hub at Whitecap Dakota First Nation, and we're proud to sign and have a sod turning ceremony ceremony earlier this summer to be able to mark that amazing partnership between the government and our First Nations partners, and we're going to continue to make sure we build those bridges and enhance healthcare for our First Nations.
Right. Thank you, Mr. Hindley. And you are actually next in our candidate to candidate. You have 20 seconds to ask a question.
Thanks, Lisa. I'll ask a question of my colleague, Mr. Clark from the NDP, and it's about the NDP's plan for healthcare. We've heard them talk about $1.1 billion in additional funding for healthcare, but not a lot of specifics as to what exactly that's going to translate into. So we've heard the hiring of more nurses, more doctors, but not any specifics as to how many more nurses, how many more doctors. What does that number look like, and what is that? How is that going to materialize across Saskatchewan?
Thank you, Mr. Hindley. Mr. Clark, you have 45 seconds.
Thank you, and I want to thank Mr. Hindley for the question. Certainly, one of the things that we don't have all the answers. We want to work with healthcare professionals. We want to be partners with nurses, with doctors, with other healthcare professionals in the system in Saskatchewan to hear them, to hear what solutions they bring forward. We want to bring back community health advisory networks back into Saskatchewan so folks, local voices can be back into the mix in healthcare and how it's delivered in communities. So we are going into this with a plan to right the ship, to be listening to healthcare workers and be working with them and communities to make sure that we're delivering healthcare that makes sense in each of the communities. We're not going to be prescriptive. We're not going to make decisions in small room in the legislature without talking to Saskatchewan people first.
Thank you, Mr. Clark. You happen to be next in the candidate to candidate. You have 20 seconds to ask.
Thank you. I'm going to pose my question to Mr. Hindley. Mr. Hindley, people are dying before they ever get cancer care. Hospitals are at 350% capacity. People have to leave the province to get life-saving tests. We're in last place when it comes to surgical wait times. 200,000 people in this province don't have access to a family doctor. Mr. Hindley, you and the Sask Party have broken health care. Why should Saskatchewan people trust you to fix it?
Mr. Hindley, you have 45 seconds.
Thanks. We've made some significant investments into healthcare, and we're not saying that the work has been perfect, and we know that there's more to do. We're grateful for our healthcare teams, and we continue to invest in them. We continue to collaborate with them across this province to make sure that we're addressing some of the challenges that we face in Saskatchewan, both in rural and remote communities, but also in our urban centres as well. And as I said before, whether it's capital projects, whether it's investments into health human resources and the action plan that we have developed in consultation with healthcare workers, we've heard that on the front lines when we talk to those that are working in hospitals and long-term care homes across this province. We've heard it from those that are radiologists and breast cancer surgeons as well. And we've worked with them to try and develop some of these solutions that are both short-term but also medium and long-term as well.
Thank you, Mr. Hindley. Ms. Bushell, it is your turn to ask a candidate question. 20 seconds.
Thank you. I'm going to ask this question of Mr. Hindley. For 17 years, we've seen a rapid decline in healthcare. We have now seen the AIMS program, which is now ballooned to over $240 million. When are you going to admit that the Sask Party and their federal liberal spending habits are what has broken healthcare?
Mr. Hindley, you have 45 seconds.
Well, I would disagree with that. I'd respectfully disagree that, and I think it does a disservice to the good people that are working in healthcare across this province, those that are working in facilities right now, and those that are part of new facilities and new initiatives right across Saskatchewan. I think there is some very important work that is being done and will continue to be done. And not saying that there aren't challenges. We know there are challenges in this province, just as there are in many other provinces right across this country. Healthcare is top of mind for many people. But we're committed through a number of our initiatives. We've already talked about the Health Human Resources Action Plan, the capital investments we've made into healthcare, and continuing to work with frontline healthcare staff to make sure that we're doing the work that needs to be done and continue to build upon healthcare right across this province.
Thank you, Mr. Hindley. Well, we'll now go back to our debate, and I will pose a question. We're going to talk about emergency services. How do you plan to improve emergency medical services response times and resources across Saskatchewan? This question will go to you, Mr. Hindley. You have 1 minute.
Thanks. And we've been working very closely with our partners in emergency medical services in EMS, whether they're the SHA-run services or privately run services such as Medavie in Saskatoon. We have worked to support them by providing new ambulances in both the cities of Saskatoon and Regina to help with some of the pressures they're facing there, increasing more training seats and having more bursaries for those that are taking training to become paramedics and tying those bursaries to return for service agreements, and have had significant uptake in that particular program as well. I meet regularly as the Minister of Health. I've done this and before as an MLA as well with frontline operators, with paramedics and ambulance operators right across this province, whether it's the Paramedic Services Chiefs of Saskatchewan and other groups, to make sure that we're trying to look at what are the challenges that they are facing and how can we best support them as a government. We've made some important investments, I think, there, but still some work to do, whether it's through the Rural EMS Stabilization Strategy, which has created and brought a number of positions to ambulance services right across this province, is just one example. And we're committed to keep doing that work.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. As I've said already today, being in the ER can be one of the scariest days of a person's life, whether it's you or a family member who you've taken in there. Under the Sask Party government, we have seen over 4,000 days in this province where emergency healthcare services have not been available for people throughout the province. I think about the nurses who were on the steps of the legislature last week talking about St. Paul's Hospital, Royal University Hospital in Saskatoon at 350% over capacity. These nurses are saying that they're not being listened to by this government. They're saying that their stories, their ideas are not being implemented. The government says that they've got an action plan at St. Paul's that was going to take 6 months. Nurses are now saying it's worse now than ever. Again, this is about listening to healthcare professionals, about staffing up in ERs so that we can keep them open across the province, as well as modernizing the Ambulance Act so that paramedics are supported, they have what they need to do their job properly.
Thank you, Mr. Clark. Ms. Bushell, you have 1 minute.
So, reducing wait times with emergency services. I know myself, I worked with an ambulance service a few years ago, and you're dealing with a lot of hazards when you're going out to a scene, you're dealing with roads, and one of the biggest things and complaints that we had was there was not enough ambulances, there was not enough paramedics or EMTs around to do their job. One of the first things we have to look at is we have to start bringing those numbers up across the province. This is something that hasn't been done. We're not looking at our rising cost of population in the province, and this is something we need to do. We need to bring those numbers up and figure out a good ratio per community on which would work best for each community. And this means having something available in every community, not just larger centers.
Thank you, Ms. Bushell. To you, Mr. Rowe, 1 minute.
Yeah. Okay, so how do we do this? Well, we bring the services to where the people are. Just recently, I'm sorry, I'm standing here and I'm also listening to both the Sask Party and the NDP playing badminton with your health. We have to actually look at the emergency services within a certain radius of where communities are. It's not just about Saskatoon. I know my mom lived there. It's not just about St. Paul's, and I agree they are 350% over capacity. I will agree with you on that one. I will give you that number. And it's not just about Regina. Saskatchewan is a lot bigger than just the major urban centers. It's time that we actually took control and we brought people back to where the people are in the rural areas. The rural areas have a voice. And that voice right now, from what I can tell, at my age, is going to be with the Saskatchewan Green Party.
Thank you, Mr. Rowe. All right, we are moving on to rural health disparities. What steps will you take to address health disparities experienced by rural communities and ensure equitable access to care? This first question will go to you, Mr. Clark.
Thank you. One of the things that we have talked about in our platform and our commitments to Saskatchewan people is to ensure that local voices have a say at the table when we're making healthcare decisions in the community. So I'm talking about community health advisory networks. These were abolished by the Sask Party when SHA was amalgamated, and people in communities across the province in rural Saskatchewan have not been able to have a voice in how healthcare is delivered with people. For people in this province. Also talked about converting a number of the job postings in rural Saskatchewan for healthcare workers, for like nurses, LPNs, doctors, from casual part-time positions into full-time permanent positions. How will we attract people into rural communities if we're offering casual or part-time work? Who's going to move their family across the province or across the country for casual or part-time work? So that's a commitment we're making to rural Saskatchewan.
Good. Thank you, Mr. Clark. To you, Ms. Bushell, 1 minute.
For rural disparities, the number one problem is the Sask Party, and in the past the NDP have done nothing but close down services, put hospitals on bypass, and made people travel to larger centres. This has to stop. What we will do is we will make sure that there is doctors or nurse practitioners in communities so people don't have to travel to large centres for that minor emergency or to get their prescription renewed. This is a big burden on individuals when it comes to healthcare, and it is very important that we make sure that they can get the best quality healthcare they can at home without having to travel more than an hour away to do it.
Thank you, Ms. Bushell. To you, Mr. Rowe, 1 minute.
Thank you. So we need to stop centralizing our healthcare medical system. We need to bring it back into urban centers, and we have to ensure that citizens, people, I don't like the term citizens, I like people, have access. We need to build a system that's going to support large rural populations, agree, but also something that's going to support the people that don't live in the urban centers. We need to have multi-level long-term care in rural communities. And I do understand that they're building this building in Grenfell, but it's been on the table for 40 years, so thank you very much. And that's what you call delay tactics. Building a healthy, active society, ensuring that they have nutrition foods, they have dietitians at their disposal, healthcare professionals, mental health workers. There should be one in every 100 kilometers of where there is a town or city.
Thank you, Mr. Rowe. Mr. Hindley, you have 1 minute.
Thanks, Lisa. Well, I tell you what we wouldn't do, and that's do what the NDP did previously, which was close 52 rural hospitals and fire hundreds of doctors and nurses right across this province. That's step number one. Secondly, my colleague from the NDP constantly references the additional positions and creating more permanent full-time positions in rural Saskatchewan. We've been doing that. And in particular, in the past couple of years, as part of the rural HHR action plan that has been benefiting a number of our communities right across this province. 250 new permanent enhanced full-time positions in rural Saskatchewan. 70 communities that have benefited from internationally educated nurses coming from the Philippines. Part of the 400 Filipino nurses that are coming to Saskatchewan to make their homes here and are now working in the communities right across this province. Hundreds of applicants to the Rural Physician Incentive Program and making sure that they are applying for those positions and committed to staying in those communities as well. And that's the work we're going to continue to do and make sure that we have faith in the rural people of this province and make sure that we support the facilities that they have in their communities.
Thank you, Mr. Hindley. We'll move on to preventative care. How will you promote preventative care and wellness programs to reduce the burden on our healthcare system? This question will go to you, Ms. Bushell.
Preventative care and early access is the most important when it comes to diagnosing some dangerous diseases such as cancer, diabetes, and this is all very important. By cutting down the wait times, making sure people can get seen, this is all part of making sure that preventative care happens. If we continue on the path that we're going, we are not going to make things better. Things are going to get worse. People are going to die under this current government before they can even get diagnosed with cancer or diabetes, before anything actually ever gets done.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
Thank you. So how do we do this? Well, first of all, we bring out things that are going to help people live in a healthy lifestyle. There are 3 levels to healthcare or to health. You should have your mental health, your physical health, and your emotional health. So we need to bring actually practitioners that are going to be able to give them information into living a good lifestyle, whether it be food, exercise, even friendship. Loneliness is a killer. Being isolated and not being able to travel to get groceries is a killer. When you start cutting back on things that are the necessities of life, you're a killer. I'm taking a strong point on this because this is what happens to our people in this province from the north to the south. If you're not in an urban area, you are forgotten. We're saying you're not forgotten and there is hope.
Thank you, Mr. Rowe. All right, we are now going to move back to our candidate questions. Again, each candidate will be given 20 seconds to ask a question to whomever they choose. The candidate then has 40 seconds to answer. The first candidate question will go to you, Mr. Rowe.
Oh boy, I don't want to play ping pong anymore. Rose, sorry. So when it comes down to rural systems, how do we actually bring this up to the north when our roads are so bad?
Well, we discussed this last night, and one of the things that we will do as a party is we will restore infrastructure up north. The infrastructure up north is something that both the Sask Party and the NDP have used as a political football for years. Neither one of them have ever wanted to touch this topic. They don't want to look at Highway 123 because they want to focus on their areas closer to home. So we have to look at this too in conjunction with it.
Thank you, Ms. Bushell. All right, the second question will go to you, Mr. Hindley. You have 20 seconds to ask your question.
Thanks. I'd like to ask a question of my colleague from the NDP, and it's around the addictions file and some of the the challenges that we face in this province. Our party, the Saskatchewan Party, has taken a focus on prevention and treatment of those that are struggling with addictions, and increasing the number of treatment spaces we have in Saskatchewan. I'd like to ask Mr. Clark what his plan would be for when it comes to addictions, and whether they would continue to support supervised consumption of illicit drugs.
You have 45 seconds to answer.
Thank you, and thank you for the question, Mr. Hindley. As I stated earlier this evening, we have seen record after record be broken year after year since 2016, with people dying of overdose from the toxic drug crisis in this province. That's 7 years in a row we have broken records. It's clearly not working what the Sask Party is doing. It's not an either-or approach, whether it's one or the other. It is harm reduction and it is treatment, and it is an evidence-based approach that we will take. We will work with those struggling with addictions, with those who are working on the front lines, with experts in the field, and we will use the best evidence we have to deliver for Saskatchewan people.
Thank you, Mr. Clark. And the next candidate question goes to you, Mr. Clark.
Thank
20
you.
seconds.
I'm going to pose this to my colleague from the Sask Party. On Wednesday last week, Saskatchewan Union of Nurses were at a conference. They held a conference in Regina. They then held a rally at the steps of the legislature. There were 400 nurses describing the crisis in the healthcare system. They invited you and they invited the Premier to attend the rally and the conference to speak, and neither you nor the Premier showed up. Why didn't you or someone from your party show up to listen to healthcare workers, to nurses on the steps of the legislature?
Mr. Hindley, you have 45 seconds.
I wasn't able to make it to the conference last week here in Regina. Now, that being said, I have met several times with both Sun leadership as recently as in September. Our teams at the ministry and at the officials level have been meeting with their colleagues at Sun for a number of months now. I've had the opportunity to meet with their leadership even prior to that, back into last fall. Additionally, I would say is that we want to make sure that we're engaging with all healthcare providers. We value all the healthcare workers in their system, but we want to ensure that we're including not just registered nurses, but also licensed practical nurses, continuing care aides, everyone that's part of the primary care team that helps patients right across this province. And that's what we're committed to, making sure that we really are focused on patient-centered care and a team-based approach to healthcare that involves all the healthcare workers right across Saskatchewan.
Thank you, Mr. Hindley. All right, our final candidate question goes to you, Ms. Bushell. You have 20 seconds to ask whomever you choose.
So I'm going to ask this question to Mr. Hindley. If you're re-elected into government, I would like to know, are you going to scrap the overinflated AIMS project so nurses don't have to wait 5 weeks plus to get paid, or hospitals don't run out of oxygen? How does that even happen in the first place?
Mr. Hindley, you have 45 seconds.
Thanks for the question. The AIMS program is meant to replace dozens of aging IT programs and systems right across the province, across a variety of previously existing health regions and health districts that frankly just weren't working very well together. And like any IT project and any IT system, eventually it needs to be replaced. They become outdated, they become susceptible to failure and to hacks and that sort of a thing. Has it worked as well as it should have? No, and that's something that we want to ensure that it does do what it needs to do. We want to ensure that healthcare workers are paid, that the scheduling is done properly. And we have our teams working on it to make sure that those issues, as they're identified, are addressed and we get the system working the way it should be.
Thank you, Mr. Hindley. All right, we'll move back to questions. We will talk integration of services. What is your plan for improving the integration of healthcare services to provide a more coordinated approach to patient care? This question will go to you, Mr. Rowe.
So we really have to dramatically expand the access that people are getting. We need to listen to those that have, excuse the expression, boots on the ground. COVID was very bad for everybody. I've seen a lot of stress happen within the healthcare profession. I've seen stress happen outside of the healthcare profession. I've lived in many different places, and the answers that they keep coming back to is we need to cut back and we need to actually try to improve our health care. You cannot improve health care if you're cutting back. That's like saying, I want a bigger car, but I'm going to remove the tires. It doesn't work. You need to actually fund this properly, and you need to listen to those that are within that profession. You need a professional medical person to be Minister of Health. You have to turn around and look at the strengths of the people, not just the strengths of the numbers and the paper.
Thank you, Mr. Rowe. Mr. Hindley, you have 1 minute.
Thanks, Lisa. I think a huge part of that solution is around team-based care. We're hearing it from healthcare providers, we hear it from patients, and I think we hear it from people right across this province. So they want to be able to embrace a new way of having healthcare delivered in Saskatchewan. And I've heard it in the consultations and the meetings and the discussions I've had with people right across Saskatchewan. Doctors want to be able to work with nurse practitioners and with registered nurses and licensed practical nurses and pharmacists and paramedics, and you name it. There's a focus now on that team-based care so that we make sure that we do have people being able to work and utilize all the skills that they're trained to do, being able to work to the top of their scope of practice to make sure to deliver the care that they are trained safely to be able to do that. So I think team-based care really is an important component of that, and I think that's where we need to go towards integration of services, making sure we have the right patient in front of the right healthcare provider at the right time.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. I think in terms of integration, where we need to start is in primary care. So right now, 200,000 people in this province don't have access to a family doctor. Without a family doctor, you don't have an advocate to help you navigate the healthcare system. So what do people do? If you don't have a family doctor, if you're sick or your loved one is sick, you go and sit in the emergency room and wait for hours. Is that the best use of our resources? No, it's not, but that's the state of things under the Sask Party. So one of the things that we want to see happen is improve access to primary care, and whether that is nurse practitioners, family physicians, either way. I am going to agree with my colleague from the Sask Party about team-based care. We think from what we have heard from folks on the front line that this is where we need to go. Unfortunately, we haven't seen results from the Sask Party in implementing this and replicating this across the province, and so we are still struggling, and people are still not having access to primary care as they should. Without that care, people don't get the health care that they deserve.
Thank you, Mr. Clark. And to you, Ms. Bushell, you have 1 minute.
When it comes to integrated approach to healthcare, we want to take and believe that we should have a more holistic approach. We need to have centers that not just have doctors in place. We need to have these centers that also include your dietitians, your nutritionists, your holistic medicines, and places for mental health. You shouldn't have to travel to 5 different places to get the care that you need. This needs to be done in a way that you can go to one place, everything is there for you, and this way we can start working on that primary care so we can work on early detection, so we can prevent things like mental health crises, suicides, complications with diabetes, and deaths from cancer.
Thank you, Ms. Bushell. All right, we are on to our next question, which has been provided by the Saskatchewan Realtors Association. When it comes to existing challenges in healthcare, are we doing enough as a province to promote the Saskatchewan affordability advantage when it comes to recruitment and attention? This first question will go to you, Mr. Hindley. You have 1 minute.
Thanks, Lisa, and thanks to the Realtors for the question. It is something that we do focus on as a government, not just in healthcare, but right across various sectors of investment into the economy, as an example. But it is important. Saskatchewan is very competitive, and it's something that we have worked very hard to focus on. As I said in my opening remarks, we're not able to make significant, important investments and strategic investments into areas like healthcare, like education, like social services, unless we have a strong and growing economy, a prosperous economy that allows us to be able to create those jobs and create revenue so we can fund those very important social safety programs and other services that are required right across this province. So we do work very hard to make sure that we have a very competitive advantage here in Saskatchewan when it comes to our tax structure, when it comes to cost of living in this province. It's why we've taken a number of significant steps towards that already leading up to the election. You've seen some significant announcements already during the campaign by the Premier, and we're going to continue to do that to make sure that everyone knows that Saskatchewan is the best place and most affordable place to live in Canada.
Thank you, Mr. Hindley. Mr. Clark, you have 1 minute.
Thank you. The Sask Party talks a lot about bringing in healthcare professionals from across Canada, from around the world, but they don't talk about how many healthcare professionals, nurses, doctors that we lose on a regular basis, that they leave this province burnt out and disrespected. One of the things that we hear from frontline workers all the time is focusing on how do we keep the healthcare professionals that we currently have. There, as I've said, 21% of rural and remote nurses have left Saskatchewan, left the profession over the last 5 years under this Sask Party. We're going to work with those nurses, with those doctors to make sure that we can keep the healthcare professionals that we currently have instead of losing them, like our pediatric gastroenterologists that we used to have, like our nurses, like our doctors, family doctors, leaving Saskatchewan specifically because of the decisions made by this government.
Thank you, Mr. Clark. And to you, Ms. Bushell.
So are we getting bang for our buck? Absolutely not. We are seeing doctors and nurses leave at a large rate. This isn't because of a non-growing and strong economy. This is because of a spending and mismanagement problem of the Sask Party. The Sask Party overspends on things like AIMS. They overspend on infrastructure. They overspend on a lot of vanity projects, something that they can put their name on, something that they can say, hey, now my name's on a university. This is not what Saskatchewan needs. Saskatchewan needs better management and better fiscal responsibility when it comes to the dollars when we look at healthcare. This is where our money from healthcare is going to come from, is better managing the money that we have already made in the province.
Thank you, Ms. Bushell. To you, Mr. Rowe, you have 1 minute.
Thank you. Great question. No, this is the only way I can answer it. No, we're not doing enough. No, we're not allocating the money properly. No, there is no way that people want to stay in a toxic environment when they're workforce. No. Does it need to change? Absolutely. You have suggestions? Fire them off to me. Because, you see, we are the ones that are going to make the change. We're here to listen, and we can actually rebuild this province to where it should be. 1 year at a time. You know, I hear a lot of people say, oh, I should have voted green last election. You know, if you had done that, we would be working on phase 2 of our plan, not trying to start in phase 1.
Thank you, Mr. Rowe. All right, we will move on to technology and innovation. How do you plan to leverage technology and innovation to enhance healthcare delivery and patient outcomes in Saskatchewan? This first question will go to you, Mr. Clark.
Absolutely, thank you. I think there are a lot of opportunities to develop technology and innovation here in Saskatchewan. We have seen Saskatchewan people have a tradition of being incredibly innovative and thoughtful and bringing progressive ideas to many avenues of life here in this province. But technology absolutely can help improve efficiencies, find ways that we can do things better in the province in terms of allowing patients to connect with specialists if they're in rural and remote Saskatchewan, and a lot of different opportunities there. So I'm excited to work with healthcare professionals across the province to integrate these technologies and see where they can improve patient care in the province. I know our team is excited about that as well.
Thank you, Mr. Clark. To you, Ms. Bushell, 1 minute.
When it comes to technology and healthcare, healthcare is not and cannot be delivered over a phone call or a Zoom call. This is not the way you do it. You need that one-on-one contact with your doctor to make sure you are getting your answers accurately questioned. That can't necessarily be done over the phone or over the computer. The one thing that we can do, though, is we can make sure our procurement processes are better by having hospitals not run out of much needed materials such as bandages, gauze, or most importantly, oxygen. And one way of doing this is getting rid of the AIMS program and find something that will not cost the province as much and be something that is more sustainable.
Thank you, Ms. Bushell. To you, Mr. Rowe, you have 1 minute.
Thank you. So your technology on keeping medical records is about as useful as a flat tire. I had a major issue in November, almost cost me my life. Could not find my records on your computerized system because of crashes. It's ridiculous, and it's redundant, and it's a waste of money. But if you put people where people deserve to be, you're going to see that one hands-on, human-to-human interaction is going to save more lives than what your fiber ops will ever do. It's a waste of money. Fix the roads, put in the conduit so that people can travel, put doctors and nurse practitioners into the communities they need to be, and save lives.
Thank you, Mr. Rowe. All right, to you, Mr. Hindley, you have 1 minute.
Thanks, Lisa. And I think there's a huge opportunity when it comes to technology and virtual healthcare and innovation. We see some amazing work already happening across this province. I know that I've heard about it and seen it firsthand with some of the leaders both in academics but also in healthcare. For example, some of the robotic surgeries that we're now performing in Saskatchewan, cutting edge technology right in our own Saskatchewan hospitals in this province. I mentioned earlier some of the work that's being done in partnership with Whitecap Dakota First Nation and Chief Darcy Bear, and thanks to him for his amazing leadership in that First Nation there on a virtual health hub that is going to make sure that we involve the latest when it comes to virtual technology in partnership with Dr. Ivor Mendez, who is leading some of that work, along with a great young team of people that are working to enhance some of that. Already underway using remote ultrasounds in places in rural communities in southern Saskatchewan, but also in remote First Nations communities. And I think there really is an opportunity there to be able to leverage that technology and that virtual care to support existing healthcare workers that are in these communities to make sure they can provide the best patient care possible.
Thank you, Mr. Hindley. All right, we're on to one of our final questions. In the first 60 days of taking power, what is the first priority you will focus on to improve healthcare in Saskatchewan? This question will go to you, Ms. Bushell. You have 1 minute.
Well, in the first 60 days, one of the first things we will do, we will start looking at AIMS. We will look at who's getting rich out of this. Who is the supporter from the Sask Party that actually got this contract? We're also going to look at private contractors that the Sask Party has brought in, like the $6 million contract that was awarded to a private clinic out of Alberta for hip and knee surgeries. This is also the same clinic that donated $14,000 to the Sask Party. The same clinic that the former Minister Kevin Doherty is a registered lobbyist for. This is the practices that we are going to look into and make sure they end.
Thank you, Ms. Bushell. To you, Mr. Rowe, you have 1 minute.
60 days. You know, in 60 days, we can sit down with the people. We can actually figure out what's going on. We can review where the spending is actually happening and where it's being wasted. And we can pull it out of there, and we can actually reformat the healthcare system so that it actually looks at people. Again, healthcare, 3 levels: mental, physical, emotional. You take one out of the equation, you have no health. You need to address the issue, and it's really deeply rooted because it's been years and years and years of cutbacks.
Thank you, Mr. Rowe. To you, Mr. Hindley. You have 1 minute.
Thanks, Lisa. And I would start by thanking the healthcare workers and the teams that we have worked very closely with on some of the very important initiatives that we've been able to launch thus far and implement across Saskatchewan. We're going to continue to do that work, to make sure that we're talking to frontline healthcare providers, to continue to work on our 4-point Health Human Resources Action Plan to recruit, train, incentivize, and retain healthcare workers in this province. We've made some significant advancements, I would say. And yes, we still have challenges that we're facing, but I think we've made some important strides, and we're making improvements right across Saskatchewan, whether it's in our urban centres in Regina and Saskatoon and Prince Albert and Yorkton and other areas of this province, whether it's in our rural communities and our remote communities. And I, for one, am very hopeful for the future for healthcare in this province and for what the potential is to be able to build upon a great healthcare system in Saskatchewan. We're going to keep doing that work, and we're looking forward, if we have the honour to form government once again, to be able to work to build that healthcare system here in our province.
Thank you, Mr. Hindley. To you, Mr. Clark. 1 minute.
Thank you. You know, people in this province take their health care very seriously, and that is something that we as Saskatchewan New Democrats do as well. We have amazing healthcare professionals in this province, and we're going to start by not taking them for granted. And unlike the Sask Party, who is tired and out of touch and doesn't seem to be able to get the results when it comes to healthcare, as I've outlined a number of times this evening, we're going to sit down with healthcare professionals, strike that nursing task force, strike a healthcare task force to get listening to the frontline workers, get to work on investing $1.1 billion into the healthcare system and turn this ship around. We're in last place when it comes to healthcare in Canada, and I think, and we think, Saskatchewan people deserve better than that.
Okay. Thank you, Mr. Clark. All right, I want to thank all candidates for a great debate. We are now moving into closing comments. And for everyone at home, earlier this evening, we did do a draw to see who would go first in the closing comments, and it will go to Mr. Rowe. You have 3 minutes.
3 minutes. So healthcare also includes our elders, our seniors. Under the description of elder abuse, as passed in the House of Commons in Canada, denial of medical attention, denial or excessive costs for medication, physical abuse of leaving people abandoned, and mental abuse is considered elder abuse according to the law. That is a description that has been passed in the House of Commons and in every legislative building in Canada. Do you know who the biggest abusers are for our elders? Is our government. They have cut back their incomes, they have increased their costs, where an elder needs to decide whether they're going to have their medication or food, or even housing. The abusers are those that are trying to tell you they need to save money. The abusers are the governments that turn around and say that people are not important enough. The abusers are the ones that actually turn around and take advantage of the vulnerable and the working class. I did say 20 minutes are up. It is time for change. It is time to actually bring people to the forefront. We are a diamond in the rough. When you look at a diamond from the face, it is multifaceted. It goes to one point at the end. And that one point at the end is humanity. If we cannot put humanity at the base of every policy that is ever made in every province and every community, then we lose track of who we are. It is time for people to say this is enough. We have rights to proper health care. We have rights not to wait 19 hours in a waiting room. We have rights to have our medication. We have rights to live with dignity. It's not going to happen if we keep doing the same thing over and over again and allowing two parties to play ping pong. It's time to make the changes. Get rid of the net and allow them to play properly. give people a chance. The Saskatchewan Green Party is here to listen to you, to work for you, to be your voice. It's time to change.
Thank you, Mr. Rowe. All right. Second was Mr. Hindley. You have 3 minutes for closing comments.
Thanks, Lisa, and thanks to the candidates and to the Regina Chamber of Access Communications for hosting this evening. Tonight was a great opportunity to compare plans, platforms, and also compare records. We know what the NDP record is. It's one of loss, it's one of closure, and it's one of decline in this province. The NDP actually lost doctors and nurses in their last 5 years of government. As a matter of fact, they lost 173 doctors and 450 nurses, to be exact. And that's their record. That's not the case today here in Saskatchewan. According to the College of Physicians, Saskatchewan has added a net 317 more practicing physicians from 2019 to 2023. There are more specialists practicing in Saskatchewan, including 28 new specialists in anesthesiology alone in 2023. There are 24 new practicing doctors in diagnostic radiology and 19 new pediatric specialists here in our province. The list goes on and on. The NDP closed hospitals, including a hospital right here in this city that we're all very familiar with. Meanwhile, the Saskatchewan Party is building hospitals and health facilities like the new Urgent Care Centre on Albert Street that just recently opened earlier this summer. The NDP shut down long-term care beds. However, the Saskatchewan Party is building new long-term care facilities right across this province, including a new 240-bed long-term care facility right here in the city of Regina. When it comes to surgeries, it's a pretty big difference between our record and that of the NDP. Today, there are more than 250,000 more people in this province in Saskatchewan than compared to in 2006. But the total number of people waiting for surgeries on that surgical wait list today is actually smaller than it was under the NDP at that time in 2006 when there were fewer people in Saskatchewan. We know that our surgical wait lists are still too long, and that's why we've implemented a plan to increase surgical capacity after the pandemic, and we continue to enforce that plan. And just last year, we completed nearly 96,000 surgeries in Saskatchewan, which is a new record here in our province. Yes, there's more work to do, but the Saskatchewan Party is committed to making sure that we will invest in surgical capacity in this province. These records matter, because it's only due to the strength of a growing economy that we can invest in more hospitals, more doctors, more nurses, more healthcare providers of all designations, and more surgeries in this province. That's why the question for this election is to which party has the plan to keep our economy strong and our future bright. And so I humbly ask for your support in this election so we can keep growing a great province. Thank you very much.
Thank you, Mr. Hindley. Mr. Clark, you are number 3.
Thank you, Lisa. It's been a pleasure to be here this evening, and I want to thank the other candidates who are here tonight to share their vision for Saskatchewan, and also the Chamber of Commerce for putting on tonight's debate. You know, listening to my colleague, Mr. Hindley, over the evening, you know, the Sask Party and Scott Moe, they try and paint a very rosy picture of healthcare in our province, except there's one little problem. It simply isn't true. The reality that their story is trying to sell doesn't match with the reality that I hear on the doorstep every single day in my constituency. I hear about people waiting in pain on some of the longest surgical wait times in the country. I hear about people waiting in jam-packed emergency rooms across the province, waiting for care. People desperately waiting for MRIs or mammograms and other diagnostic testing. Scott Moe and the Sask Party broke our healthcare system. They cannot be trusted to fix it. Mr. Hindley wants to talk about what happened in the 90s. I was in elementary school in the 90s. I think the issue with the Sask Party is that they want to always look back to the past. They're not focused on the issues that are most important to people in Saskatchewan right now in terms of healthcare. Right now, in the last 5 years, we've seen 4,000 emergency rooms across this province closed. That means that if you are having a medical emergency in rural Saskatchewan, you drive to your local ER only to find a piece of paper on the door that tells you, oops, it's closed. Try another hospital somewhere else. That's the reality. Every single day in this province that is happening in communities. In this province, their record today, 200,000 people don't have access to a family doctor. There are 21% fewer nurses in rural and remote Saskatchewan. That's 500 nurses that we have lost in rural Saskatchewan over the last 5 years. There were 400 nurses on the steps of the legislature on Wednesday this week. They were calling on the government to hear them, to listen to the crisis that is happening in healthcare. And the Sask Party couldn't be bothered to show up. That tells you everything you need to know about how they're listening. Carla Beck and the Saskatchewan NDP, we have a plan to fix healthcare. We will invest in more nurses. We will hire more doctors. We will invest an additional $1.1 billion into healthcare over the next 4 years. We will strike that nursing task force. We'll strike a healthcare task force. We want to modernize the Ambulance Act so paramedics in this province are supported. And we don't hear stories about 16 stretcher beds in the Royal University Hospital waiting for care on a given evening. Those are the results of the Saskatchewan Party. We're ready to listen to healthcare workers. We're ready to embrace their ideas and treat them with respect. Saskatchewan, it's time to get us out of last place when it comes to healthcare.
Thank you.
It's time for change.
Mr. Clark.
Thank you.
Pardon me.
Ms. Bushell, closing comments. You have 3 minutes.
First off, Lisa, I would really like to thank you again. You're doing an amazing job. Chamber of Commerce for putting this on, and also to my fellow candidates that are standing up here with me tonight. 17 years. 17 years we have seen a declining healthcare system in this province. This isn't from lack of funding. This is from overspending on other vanity projects that shouldn't be in place. We have seen now the whole AIMS project, which in reality is nothing more than the equivalent to the federal Liberals' Arrive scam app. This is something that was supposed to cost taxpayers less money than what it is. It is now ballooned to over $240 million. This is a colossal waste of money. This is money that could have been used for frontline workers, for needed medicines, for needed items in hospitals that we are running short of because of this project. The Progressive Conservative Party would be that strong voice and balance of power in the legislature. We would keep the government, whoever becomes in power, in check. To make sure they stop the overspending and make sure our healthcare system has better than adequate funding. It was because of Saskatchewan that we currently have universal healthcare in our country. It was thought of here. It is time we recognize this and take pride in that. We need to take pride in our healthcare again to make sure we have quality healthcare across this province and become the innovators when it comes to the field of healthcare again, just like we were when universal healthcare first came about. We have the potential to become the envy of every single province in this country again. But we are not going to do it with the current government or the current two-party system that we have in the legislature, a system that they want you to think that's all we have. We need more, we need better, and strong voices in the legislature, like the Progressive Conservative Party of Saskatchewan, will be that voice for you. We are here to listen, we are here to advocate for you.
Thank you, Ms. Bushell. All right, well, we have come to a close, and I want to thank you, our panelists, for your passion and being part of the democratic process. To you, our viewers, we thank you for joining us. Democracy is a wonderful privilege, and we hope you exercise your freedom to vote on October 28th. Our first debate for the evening has come to an end. Our second debate will begin at 8 p.m. on the topic of fiscal responsibility. While we get ready for that, Kyle Addison is standing by with Colin Pueller, Chris Gurett, and Joel Peterson to break down what we just heard during our first debate. Kyle, over to you.
Thank you, Lisa, and thanks to our Access viewers who are joining us tonight for Night 2 and Debate 3 of our provincial debates. Tonight we had focused on healthcare, and Debate 4, following healthcare, will be finance and fiscal responsibility. My name's Kyle Addison. I'm the chair of the Regina District Chamber of Commerce, and I'm going to be hosting a discussion panel with you this evening. And joining me today, we have three panelists, that are subject matter experts in their own right. We have Joel Peterson at the end with GSD Strategies. We have Colin Pooler to my left with the Saskatchewan Construction Safety Association, and Chris Garrett with the Saskatchewan Realtors Association. I'll now hand off to Colin to explain what his organization does for our community.
Great. Well, thanks, Kyle, and thanks to Access, and welcome to the folks here on the panel with. So the Saskatchewan Construction Safety Association, we're an industry-led organization, about 10,000 members in the province that are construction companies. And the reality what we do is a tremendous amount of work with them in terms of risk management, preparing workforces so they're prepared for managing risks, avoiding injury, that kind of space. But the reality is for a lot of our companies, a big reason why we're here is to help support their own economic development, helping them manage their risk, and so they can have a lot more prosperous type of organizations.
Great, thanks, Colin. Chris, tell us about the Saskatchewan Realtors Association.
Yeah, thanks, Kyle. Saskatchewan Realtors Association, we are a professional association, so we represent, entrepreneurs, professionals in real estate, so individuals that trade in either residential real estate, farm, or commercial. And so we have 1,700 members throughout the province. That represents the majority of, the real estate professionals in our province. But we also work with business partners, so 200 business partners that are not necessarily realtors, but who work in real estate in different ways. And so we do that. And so it's throughout the province. We are the third largest sector by GDP in Saskatchewan when you take a look at all of the real estate sector. And most people know us through housing, but we do a lot of commercial and farm as well. And so, but we like to say that for every home that is sold, the impact to the economy is about $54,000 additional dollars pumped into our economy for every transaction. So that's significant.
Interesting. You're almost a one-shop stop for all things real estate in Saskatchewan.
That's right. Yep.
Yeah, right on. And Joel Peterson with GSD Strategies. Tell us about yourself and how your organization impacts our great province.
I'm part of a company called GSD Strategies. We're a public relations, government relations firm. I help organizations and associations like Colin's, like Chris's, navigate their way through government. I've worked in government and been political for, going on about 25 years. So, I find that in a lot of situations that associations haven't built the relationships, haven't built the strategies in order to move their wishes and desires within the government forward. And I sit back and try and help them find their pathway through government.
Right on. Thanks, Joel, and thanks to all three of you for joining us here this evening. We have a lot to talk about, but I think we're going to start with what everybody wants to hear, the fun thing. Who do you think won the debate this evening? Joel, let's start with you.
It's interesting. Debates, I don't know if anybody wins a debate. They say that they call question period, not answer period, because you don't get any answers. And I kind of find the debates the same thing. I don't find a lot of answers coming out this. What I found in this one, there was a lot of attacking, a lot of, what you're doing isn't working, but I didn't hear what we're going to do is going to make a difference. If I was couching a winner, I would probably say that Everett and the Sask Party won. They have kind of a clearly articulated plan. The other ones I found said, we don't really have a plan yet. Our plan is to talk to people, and then we'll have a plan. Problem there is you're 6 months or 8 months down the road, and that's how many surgeries or how many hospital visits and so on that haven't been addressed yet. So
very interesting. Chris, do you have any thoughts on who do you think stood out? Or
Yeah, well, I would measure it based on the detail that I heard and tied to any sort of financial responsibility as well. So if you take a look at it from that lens, I think the incumbent had an advantage there because he had that file. So Everett from the Sask Party absolutely had more detail, was obviously well briefed on that file, so knew it very well. But unfortunately, I heard a lot of, here's what we have to do, and large ideas, but not really some concrete or transformational points that are very innovative either. So I guess I was also a little bit disappointed from the debate. I was hoping to have a little bit more in terms of what is your platform to move that forward in some more detail and tie that to actually some dollars.
Great, Colin.
Yeah, I would agree with you there for sure, Chris and Joel. I think one of the challenges here in a format like this is that the ideas don't get fully fleshed out for the audience to be able to really appreciate what the thinking is and where they're likely to go. I think the advantage was certainly to the incumbent because they had the file, they're very well briefed, and they could articulate the direction that they're going very, very well. The opportunities, I think, were certainly there to dig into the finer details in terms of identifying key challenges that people in our community are having with respect to healthcare. That came through very loud and clear. But it was sometimes difficult to see what the solution was. And that's really the part that was a bit challenging for me to say, well, okay, so what are the opportunities that we can actually take advantage of to do something to move the needle on that? So that seemed a little bit weak. But again, I think this particular format doesn't lend itself for the opportunity to be able to fully flesh that out.
Yeah, I agree. Because we hear a lot of discontent, and I think that's what you would probably hear at the doorstep as well.
Right.
The electorate is very frustrated with the status quo on either side of the spectrum, I would say. And so I think you could see that coming through the candidates as well.
Interesting. So would either of you say that there was a point in the debate that stood out to you that really shone a good light on what each party and each candidate has in their platform leading up to the election?
Well, maybe I'll start off. I mean, certainly there's a lot of passion, which I think is really important. I mean, there are people that, whether it was describing a situation from a personal perspective or somebody that they've connected with that has had challenges with the healthcare system and wanted to find a solution. And I think that's really important because as we are, moving through very difficult challenges here, there's no easy answer to this. It's going to take a lot of drive and a lot of collaboration to make these things work. And whether it be some of the conversations were with respect to engagement of our workforce to try to find solutions. I know we're going to talk a little bit about technology, and I think it's going to need that kind of energy to be able to close the gap on some of these particular challenges. And outside of that, I found it again, the format itself didn't lend itself to be able to kind of have a discussion where you go, hey, there's maybe a solution here or a gap that we can close.
Yeah, I think what struck me with this is, as I said previously, the discontent. You could also sense it. And, it's tough with healthcare. Healthcare are very, as some of the candidates said, very human issues, right? They're they hit at the core, they hit at everybody's heart, and I'm sure there are many stories out there of how you've lived the healthcare system. So I'm hoping moving forward in the election, though, that we can, that the voter will be making decisions not based on, their emotion, but on what are those solutions that make sense. And to do that, I think the candidates are going to have to shift that conversation as well, to not be so emotional about it. I mean, it's okay to have some emotional side to it, but at the same time, you need to talk about those policies and be responsible because you are going to be the elected person who's going to be making some very serious financial decisions. So I'd like to see a little bit more of that so that it's a bit more balanced, and that struck me a lot this evening.
Interesting.
I think the one thing that I noticed is an agreement on one of the issues, and it was the team approach to healthcare. It seemed to me that all parties kind of said, yeah, that's the way we need to go, and I think that's probably a model that people are starting to look for. The frustration was, well, I've got to go to X doctor for this, and then I've got to go to this specialist for this, and then this specialist for this, and this specialist for this. I think that we probably saw the start of something that may have, some benefit to healthcare system. I think one of the interesting questions too that was in there was the one with respect to preventative health care. Like if it kind of is a topic that's not discussed very well. You don't need health care if you live a healthy lifestyle, if you understand what I mean. And I think that's probably part of the health care that needs a little bit more thought, needs to be addressed a little bit more. You know, if you have, and we heard dietitians and those people, the larger costs aren't as noticeable on the healthcare system. You know, what is an ounce of prevention is worth a pound of cure. That's probably a good mantra.
I 100% agree with you, Joel. You know, I think we talk about in construction around mental wellness, right? The term wellness, which is really a preventative action on how do we get to a point that we are healthy. Yeah, we're going to have challenging days. We're going to have times we have a cold, you know, a cold in our body, a cold in our mind, whatever it might be. But on balance, we're able to prevent the big things from happening, the big crises from happening physically, mentally, otherwise. So, I mean, this preventative care becomes really important. It cuts down a lot of future costs, both at a personal level, but also just right in the pocketbook and tying up resources, whether we're finding in doctors' offices or emergency care centers, those kind of spaces.
Right on. Chris, you had mentioned a bit of discontent in the debate just prior to this conversation. Joel, I want to ask you, you've been in politics for a number of years, quite a while, I would say. Not too long, but a fair bit of time. And I'm just wondering, from your perspective, is it normal for there to be that type of discontent after a government's been in power for so many years, for 16 years?
I think you see that. I think the Sask Party has ridden a fairly good wave. They've had majority governments for quite a long time, so they've been able to implement what they wanted to implement. What's happening right now is, and I think Jared said it, you know, in 2007, I was in high school. The Sask Party is starting to have to defend the direction that it's taken and defend its policies. That's what happens when you've been in government 17 years. You know, things that you haven't accomplished come home to roost.
Interesting. So, like I said, tonight is debate 3, night 2, but debate 3, we're focusing on healthcare this evening. Yesterday in debate 2, we focused on infrastructure. So I'm just wondering, what, from your perspectives, from each of your individual perspectives, does infrastructure play in delivering healthcare?
Yeah, well, you know, maybe I can talk first on this one. I mean, there are lots of aspects. We see it obviously from the construction side, where you've got buildings and roadways and that kind of piece of infrastructure for healthcare. So there are the facilities themselves, but there's also the technology side. We were talking, you know, just before coming on, we have these urban and rural divides, you know, in terms of technology and services that could be available for people, particularly living in remote areas. And you know, that's a critical part of the infrastructure to give successful delivery to these locations. And whether that be through some innovative approaches, whether telehealth services or being able to connect by video conferencing with a physician for your primary or your preventative care side of pieces, so you could free up the resources to be able to deal with the more critical issues down the road. So, you know, I think the infrastructure by itself is, I know that discussion was last evening during the debate, but it carries over so much in the healthcare side as well.
Yeah, and I'm not a healthcare expert by any means, but I do think many sectors have a responsibility to start thinking about transformative change, right? So when it's tied to infrastructure, how can we better deliver a service for less or the same amount? How do we do that? And it's not just change, it's really more about that transformation. How can we reimagine how we do this? Because if we're going to be putting in the same solutions that we had 15 years ago, we're just going to be repeating some of the landscape that we had back then. So I'd like to see more talk about that, but I realize that's not a very attractive political conversations, but I do feel there's a responsibility to go there in healthcare. And I would argue Saskatchewan is really well poised to pilot some really cool things. We have a vast territory, a low population, compared to the rest of the country. And that's really what you need to kind of test some things out. And if your intent is really to get ahead faster and further with less, I think people would want to try that, right? But I also realize this is maybe not the time, coming out of the pandemic, individuals are very, their nerves are fried is how I would describe it.
Absolutely.
Yeah, we've asked a lot of our population on, it doesn't matter what your political stripes are, we've asked a lot of our population, and I think we're feeling it in this election.
Safe to say healthcare is always a difficult issue. It's always a difficult task to complete in terms of governance and administration, but post-COVID, I think we've really seen how difficult healthcare can be. Joel?
I think that COVID exposed.
Yeah.
Yes.
You had expectations of a healthcare system that couldn't be met, weren't able to be met, and I'm going to pick up on what Chris says. I think the infrastructure side of it, I think the transformative side of it, I think there's opportunity there, and I'm not, I don't know if that's physical buildings. I think that there are different ways of doing things that we haven't tried, and until you try them, some of them may fail, and we have to be prepared for that failure, but we have to try at delivering things in a slightly different way. I think all four of us, and I think everybody in the room there, thinks that healthcare is broken in some way. And the only way we're going to fix it is trying to figure out better ways to do it. And if we don't try new ideas, as Chris said, we're just going to continue with the same problem that we have right now.
And sorry.
No. I'm just so excited.
I think, and this comes from a very privileged place because I'm a healthy person, but the old saying of don't let a good crisis go to waste, right? Because that's when you're going to find that innovation, because you're forced to look at things differently. And we've seen it during the pandemic. I could give some examples of municipalities that just really over-delivered on permit processing because they were forced to look at things differently. And the bar was raised, and kudos to them. But so I think there's somewhat of a crisis here. Again, I'm a healthy person, so that says a lot. I'm sure the person who is relying on the healthcare system every day would probably not say the same thing. But at the same time, we've got to move beyond where we're at.
Yeah, and really, and I think thanks for saying what you just said there, because I think there's also an opportunity here that. Again, last evening, there was a lot of discussion on how do we attract and retain people in this province. And by having system, by being creative with some things, we may set ourselves apart from our competitors, our neighboring provinces and people around the world to say, there's something different here that I want to take advantage of. We talked earlier about people that have made the move because they couldn't access something in their local community, so they physically picked up and moved to another one. And we have this window of opportunity, and unfortunately, sometimes it takes crises to force us to look at things differently. But if we do, and we can make that move, all of a sudden we're different. Absolutely. And so the people that come here, we talked about stickiness last night to our community. People are coming from around the world, come here and find something that they're not easily able to find elsewhere. So it'd be great to be a leader in some of these areas again.
That's a great point, Colin. Let's dovetail off that. How can we utilize healthcare to attract and retain residents from other provinces in Saskatchewan to do some interprovincial migration towards Saskatchewan? Is there anything on the top of your mind that we could try to?
Well, I think healthcare is like a spoke in that wheel, right? Of there's not one thing that's going to bring individuals here. A family that's going to uproot, their kids, they're going to look at a number of things. Yes, they're going to look at healthcare. They're going to look at schools. They're going to look, and this is my plug for affordability and housing. They're going to take a look at housing. How much can that dollar get, right? How much of a home can they get here compared to British Columbia, compared to Ontario, Manitoba, right? Those are the things that they're going to look at. But yes, healthcare is a pretty large spoke there in that wheel. But I think we have to take a look at all of it. And this is an unpopular opinion, and I think it's an unpopular opinion since the pandemic. But I think Saskatchewan's challenge is a population one.
Yes.
We need more people. And I know that's an unpopular opinion right now, and I get it. But when you take a look at financially, jobs, and we do need to bring more people here for some of the jobs and the gaps that we have. We are a very welcoming province. We have lots to offer. We're very affordable, and I don't think we tout our horn loud enough. I think we could be showcasing Saskatchewan and the benefits that we have here a hell of a lot more than we do right now.
Very well said. Joel, from a political perspective, over the years that you've been in politics, how difficult is healthcare in the world of politics?
You can have that big question.
Yeah,
We'll just sit back and relax.
thanks. I think I can answer that question on how much of the budget it takes up,
Right.
right? So and I may be wrong on this, but let's say it's approaching 50%,
Yeah.
which is pretty close to what it is. How big? It's huge. And as Chris was saying in her comments, when people move here, if you're moving here as a minor, if you're moving here as a lawyer, a doctor, a nurse, the things that you care about are quality of life. And if your healthcare system doesn't provide you the appropriate quality of life or expected quality of life, it's not something that you're going to come to. I want to pick up on the last question if I can. I think one of the things that we were talking about is innovation, and you were talking about bringing people here. I think doing things in a different way and being innovative draws people in.
Yes.
If you create a pilot project on X, the people who are on the cutting edge, the bleeding edge of this, are going to come because it's exciting. And one of the pitches that I have within Saskatchewan and within the work that I do is Saskatchewan is a small province, small politically, in the sense that you can get through the system a lot quicker than you can in, say, BC or Alberta. I mean, both of those provinces have, double and triple and quadruple the population. They have quadruple the bureaucracy and so on. Here, you can have an idea, you can have it as a pilot project, and you can have it delivered, if the whole process goes correctly, within a year. I'm not sure that you have the availability of that in other provinces. So it's a great place, and innovation brings in cutting edge people, it brings in smart people, it brings in people, and it brings in people to deliver the services that you're innovating with.
Good.
And I think we're going to have to be careful this election. I think I just had an aha moment as you were delivering that. I find it a very, the discontent is what we're focusing on, and that is going to have an impact on our sort of collective self-esteem, if you will, of how we sell our province. And we do a lot of really great things in this province, and I hope that there are some candidates and some parties that are going to start bringing that out. I realize elections are about, how can we do things better? Where do we want to go? It doesn't always need to be about focusing on the negative so much. So anyways, that's just my little takeaway from what you said. We need to, I hope that we can be a little bit better at showcasing Saskatchewan for how great we are, because we have some really great things going for ourselves. But I fear the month of October is going to be really heavy and we're not going to have enough room to squeeze that in.
Well, that was one of the reasons why I said, the opportunity to kind of flesh out the ideas. Like, it's certainly important to identify what is wrong. That's a critical step.
Opportunity for improvement.
Right. And then what do we move? How do we move from there? What are the opportunities available to us that could possibly address that?
Yep.
And then have those discussions. And like you said, Joel, there was a point in tonight's debate where you could see the beginning of something where it was almost it was a team approach to,
Yes.
there was almost an agreement on that.
There was,
right? And and that's important. And that's the area that we want to be able to get to. So, my hope over the next, number of days, we don't have that many, is that we're able to see some of that. And because that's what I think people want to be able to grab onto and say, there's not just, identifying a problem, but hey, there's a group of us that are willing to do something. Because whatever the solution is, we're all going to have to lean in to make it work. And so, when you're being able to see people who have come from different viewpoints actually be able to kind of congregate around something, that's where a real opportunity starts to show up. So, just my thought on that.
And the fact that they all picked it up.
Yeah.
There is something there. It's got to be fleshed out a little bit more, but there's something there. Everybody, there's a beginning of a good idea.
Great discussion, great points, great insight. Wise like Yoda, you all are. We're all coming together as a bit of a team here. This is great. Colin, with respect to the Saskatchewan Construction Safety Association, is there anything you'd like to see in an election platform from your organization?
Well, I was mentioning this earlier that, certainly, mental health is a major concern, across, we're seeing it everywhere, but, a lot of people do not know that in construction in particular, this is a particular concerning area for us. And, we've got, lots of challenge with particularly young men who are working, whether remote from home or, when I say remote from far away from home, maybe feeling isolated. We just have a very high percentage of our workforce that has significant challenges in terms of wellness in that space. And so this has been really important to my membership. It's brought up many times around my board table, and just about how do we keep our workforce mentally well. And so it's not just about the substance challenges, that's kind of the acute part of it. But it's really on being well, coming fit for work, and that's really the space that we're dealing with. Unfortunately, we've got some really unfortunate statistics in terms of this space, in terms of men's health, particularly in construction, and suicide rates that are 7 or 8 times that of the national average. We see that in construction. So this is an area that love to hear more about in terms of tools, in terms of services that can help people who are working on the go, and that's just not in construction, obviously, but it's pretty acute there.
Yeah, that's too bad. I wasn't aware of that. That's unfortunate. Chris, do you have any, what would you like to see with an election campaign strategy coming forward?
Yeah, well, we're fortunate to have a really productive collaboration as a team. We do it in the housing sector and in real estate. We partnered with, for our second report now, with the Saskatoon and the Regina Home Builder Associations, as well as the Saskatchewan Landlord Association and ourselves, to really, one, poll Saskatchewan residents on what's important to them, and then 2, what are those aspects that we would need to see to have a stronger and a healthier housing continuum. And so, no surprise to us, but maybe to many others, 7 out of 10 Saskatchewan residents do feel housing is important and needs to be addressed. So that's significant. And affordability is the top issue. Top 3, so affordability was first, health care was second, and housing affordability was third. Economy was fourth, right? That was surprising to me that economy was fourth, because the economy is very tied to affordability, but from the perspective of the resident, that's how they sloshed it in terms of the top 3. So we like to see things such as incentives to help individuals become homeowners. We're one of the youngest populations in Saskatchewan, and so it's important to us to have that same percentage of individuals who can get into home ownership. And if we're the most affordable in the country, we'd like to think that we're also, home ownership rates are also higher They're not that much higher. So we still have an opportunity to move the dial there a little bit. So how do we help individuals become homeowners? How do we help those who are renting and are feeling the squeeze right now of rent hikes? How can we support both the housing provider and the person renting so that we have a more comfortable housing continuum on the rental side? And any sort of tax incentive to help our builders build more homes faster. Good. We know how to build really great homes here in Saskatchewan. Actually, we innovate. We're the home of some really great innovation on the green energy side of things. And so, we know how to do it. We just need some businesses that need a bit more support to spit those houses out faster.
Good. So this agreement, this partnership with your colleagues,
yes.
Is this the Secure Homes Strong Future policy framework or policy blueprint?
So it's the blueprint, Strong Homes, Secure Homes, Strong Future, and it's a blueprint for policy and decision makers to help them with what could be potential solutions. And there's a number of different recommendations in there, but it's boxed into 4 different categories, essentially, from rental to home ownership to inventory, and the most important one in my mind is affordability. And we always say your housing continuum is strong if it has varying price points and there's choice. So choice of what communities you can be in, what amenities in those communities, different price points, ownership types, rental. So as long as you have a lot of choice there, then you have a strong continuum that your population can move up and down with relative ease.
Interesting. Joel, you were smiling at me. I think you might have something to say.
No, I was just thinking. I'm going to answer the question that you asked these two with respect to what I do. And what I really want is a government that listens to new ideas. Yeah. That you know, in a lot of situations, the folks that I work with are innovators, are kind of the cutting edge of this. And the opportunity to pitch it to government and to say, look, there's a different or a better way of doing something like that. I want a government that is open to ideas, open to new ways of doing things. From all of them, I would say all of them said, we want to talk, we want to listen. Proof's in the pudding. Once you're in government, you've got to make sure that it's that you have that ability and that ongoing dialogue. But you also have to make decisions based on that. And it's like I said, it's what do I want to see? I want to see a government that's open to new ideas and slightly different ways of doing things. If you're using 60, 17-year-old solutions to modern problems, you're 60 or 17 years behind.
Yeah.
So go ahead, sir.
No, thanks for saying that, Joel. I would agree 100% that, what I've observed and Chris and I worked together for a period of time as she was on my board, and so saw many of the same things. Some of the most creative people in Saskatchewan, are people who are small entrepreneurs that have grown great ideas and have brought some really interesting solutions to sophisticated problems. Right. And that's, one of the challenges that we've had in Saskatchewan is to be able to, feel proud enough to be able to share that and broaden that. And, so I think you're 100% right there, Joel, in that. That people want a government that is going to say, hey, listen, we want to listen to these problems and listen to these potential solutions. We want you to collaborate. And build these out with us, because I don't know what it is about this part of the country. Maybe it is because we're a smaller population, so we could test things and fail fast or move it to the next level rather quickly. But there are some really cool things that come out of here that we don't really think about, but have global impact when they actually get out into the wild. Okay. And I think if we have a government that's willing to listen and support and foster that, I think we can create a lot of new and great ideas, whether it be in healthcare or we're dealing in infrastructure or other elements.
Right. Joel, just to extrapolate your concept of new ideas, retaining government, that sort of thing, are we, from your political perspective, and in looking at Alberta and their 42 years of a political dynasty, do you see any relation with the Alberta PC political dynasty and the Saskatchewan Party in Saskatchewan?
That's an interesting question. Yes and no. The older a government gets, probably the more internal it looks. One of the things that I see governments happening, and this is no shot at anybody, is when you first come in, you're reliant on your ideas. And then what you want to do is you want to take those ideas and you want to give them to the bureaucracy, and then you want the bureaucracy to say, well, we've done that before, or, change it, here's how we think it could work. I think what you see in both of those is that at a given point in time, you start to become a little bit more heavily reliant on your bureaucracy. Not a real big issue, other than, in my experience, bureaucracies on the whole are quite conservative. They're incremental in their approach, and some of the things that we're talking about, it's not an incremental solution that's going to make it. It's a transformative solution that's going to make the difference on that. So, 40 years in Alberta, problem is you start to have a smaller and smaller circle of who you're talking to, who you're listening to. Yeah. That goes back to the question, or back to the conversation that we were just having. I want to see it open up again. I want to see from all the parties. I want to see it open up again and an opportunity to listen, because I think on the whole people have good ideas.
It's easy to get comfortable.
It is.
It's really easy to get comfortable. And I think even opposition or governing party, you have a responsibility to select where you want to impact transformative change. And not every sector, not every project is going to be ideal for that. And you're going to want to have some instances where you're a fast follower, and that's okay. That's not a failure, right? You need to realize what opportunities are good for you and how to showcase that. And others, you just kind of want to wait back and you're a slow follower. But as long as there's a good combination there, because you can't be transformative everywhere. You can't. You really, really can't. And you need to allow even your population to have some comfort level with some services. But I would challenge both the leading parties anyways to really identify, where do you want to have transformative change? Where do you want to be a fast follower, and that's okay.
Yep.
And then where are you a slow follower, because that's maybe not a priority right now, but it's coming, because we can't just push at the same volume everywhere all the time. And I'm not seeing that much in the debates and in the platforms right now. But we're just at the beginning, right? We're at the beginning. So it's very clear that affordability is a key issue, and that healthcare and education are sort of those secondary pieces. And I would say even affordability is trickling into healthcare and education in there. So I don't know, I'd like to see some more bold conversations out there.
Yeah, that's great. And Joel, sorry, I'm just going to come back to you one more time. We've seen throughout the cities in Saskatchewan a tightening in the polls, if you will, and we never know if we can believe the polls. We never know where the polls are actually coming from, if they're opt-in, if what the actual methodology is behind the polls. But do you think, with that 42 years in Alberta of a political dynasty that the PCs had, do you think that they, after 16 years, had a bit of a tightening in the polls as well before they overcame?
Yeah, I grew up in Alberta, so I got to experience that, and what you saw over different periods of time within the Alberta political sphere is that you saw the Alberta Liberals go up to become, for the longest time the NDP were the opposition there, with 2 or 3 people in there. Liberals came up, and I think they had 16 at one point in time, and they kind of trickled down over a period of time. And then the NDP came up with Rachel Notley. Yeah, I think what happens is, it's interesting because I've watched 3 of the debates right now, and the NDP are using a time for a change, and it's a tried and true political comment. Doesn't matter what party uses it. There's probably a little bit to that. The one thing I wanted to pick up on with Chris when she was talking too is, one of the things we're seeing change within the Sask party as well. Like when you see 21 people leave or retire.
Yeah.
I think the potential of seeing a different kind of Sask party is there. I think there are some, there's a diversity in there that hasn't been there before, and I think you'll begin to see that. In Alberta, my experience is that diversity didn't happen. It was probably one of the things that was the downfall of the Conservatives in Alberta when it happened.
Very interesting. Oh, thank you for that. That's a good piece of history, good piece of wisdom from you.
Canadian Studies degree.
Canadian Studies
Have
degree.
to use it for something.
There we go. It's working out well for you right now. So debate number 3 was based on healthcare. We're going to pivot away from that, and we're going to go into, well, we're going to foreshadow, I guess, a bit of debate number 4. In that debate, we're going to have Minister Donna Harpower with the Saskatchewan Party. We're going to have Trent Witherspoon with the Saskatchewan NDP. We're going to have Rose Bushell with the Progressive Conservative Party of Saskatchewan, and Naomi Hunter with the Saskatchewan Green Party. So, with respect to fiscal responsibility and finance, does anybody have anything they'd like to preempt the conversation with?
Well, I can't wait to watch because, from the Sask Party and the NDP, those are 2 candidates who have a tremendous amount of experience in Regina right now. And Donna Harpower was the longest serving minister in Canada. So she's got a lot of experience. So she's going to have that background that she's going to bring to the podium later on, and that's definitely an advantage. She knows her numbers. She's been finance minister for a number of years now, and so those 2 candidates head to head, I think. Well, Donna Harpower is not running anymore, but certainly involved in the campaign, and so that's going to be interesting. And I hope we can get beyond the negative and actually the vision behind where we want to go. And as you've said, it's going to require some bold conversations. Doing what we've done before or going back to how it was is not actually a solution in my mind. And so I'm really looking forward to the conversations.
I'm really interested in here, and I agree. I think we have essentially 2 heavyweights in that room. Very well experienced people that can speak to at some depth, some great depth. And I'm also interested to see some of the new ideas that we brought in. But the thing I'm really looking forward to in this discussion is the priority around what kind of investments that we make as a province. And we'll really find out, we talked about healthcare, and that's true, but what kind of new things, they may not always be, but what kind of things are we going to be saying that these are the priorities that we're going to put our dollars, our time, and human efforts into to make things happen, whether it be rural broadband. I got it all out. As part of the infrastructure piece that we talked about earlier. Is it going to be something in terms of facilities, which is other infrastructure we spoke about? Is it something innovative in healthcare? Again, I'm really interested to see where that plays out. And so I don't know what to expect, but I'd love to see that.
It's a good point. I like the what's the vision, and then how do you do it fiscally responsible?
Yeah.
On that, and I think you've seen the NDP and the Sask Party fight back and forth because the NDP released their costs a while ago, and there's a lot of political bantering on whether or not you've costed this out and you costed this out. It will be interesting to see in the debate if they come out with, this is the vision that we have for Saskatchewan, and this is how we're going to do it responsibly. And I think that's what people are looking for. It's you don't buy a home and then hope you can pay for it, right? You don't do that kind of stuff. You plan it out, and I think what people are looking for is that plan. And hopefully with the debate coming up, we'll see who puts forward the best plan.
In the construction side of things, and Chris would be, really well aware of this, it's not always on the tax and what's being spent on infrastructure, as much as it's sometimes the policies that are there to support that. So, whether it be permitting or some other pieces that often can get in the way of businesses or entrepreneurs being able to move quickly to be able to respond to things like housing, where we've got, we want to be able to do a development or some major project. And sometimes, I'm going to say, not to beat up on the bureaucrats, but sometimes there's bureaucratic process that slows decision-making down to a point that people can't actually make the decision anymore, and the costs start to escalate. So, interesting to see, it may not be something that is central to the finance picture, but it has a huge impact on the, in terms of responsibility in terms of companies, individuals making investments in the province as well, because that's going to be part of the job too, is making sure that people do invest.
And I hope what will come through as well, because you said this earlier in terms of that momentum, that success and that collaboration creates momentum where other people want to come. And, individuals who are thinking of maybe investing in Saskatchewan, from, larger investment to individuals moving, everything that is being said during this election, especially on the financial side, is being taken note of. And so it'll be important that we also frame that very carefully, because I would hate to be in a position where people say, it's not a great place for future investment in Saskatchewan, so I'm just going to hold off a little bit. That would not be a result I would want to have after this election.
Good point. I'm just going to throw a nice little softball out there and say, ask you all, how important is it for the government to collaborate with the private sector?
Oh my goodness. It is critically important. Yes. But it's also important that we're an economic sector, real estate as an economic sector. I feel we have a responsibility. Our core responsibility is serving our members, our professional members. But I do feel for the province, we do have a responsibility to give as much information, insight, knowledge as possible from our members that are the boots on the ground, right, to those decision makers, so they have what they need to make an analysis and make a decision and have that conversation. And that's a really critical role, and I'm guessing it's the same with you.
100%.
And that is a lot of investment, and no matter what, after this election, because there's a certain renewal happening with the Sask party, and if the NDP wins more seats, there's going to be a lot of new faces out there, a lot of new MLAs, and it's going to be a large investment for the private sector, for professional associations that represent the private sector, to invest, build relationships, show them how we can help and why and where we can't, and how we can collaborate, because we have the same goal. It's making a stronger Saskatchewan, having a more vibrant economy, and a more affordable province as a whole. I think we could probably say that for all of the businesses that we have the privilege of representing. So it's going to be a big job after this election.
Very well said, Chris.
Yeah, I don't know if there's much I could add to what Chris said there, but because over a third are going to be brand new no matter how we cut it. Yeah. And so it's incumbent on the business associations. I know certainly in the construction sector we've got many industry associations, because it's a big sector, that know that they're going to have to do a lot of work in educating new members of the legislature, new members who are going to be members of cabinet, senior decision makers, working with the bureaucracy to know, hey, there's ways that we can help you advance the agenda in efficient ways. And they want to do that. It's something where nobody really likes to see a bunch of waste happening, because nobody really actually benefits from that in the long run. Yeah. So they want to do things that are efficient, more productive, creative, and will be built to last, which is something that we always talk about in the construction sector. So that's going to be a lot of heavy lifting, like Chris said. Like it's going to be a lot of work. I know with our own organization, we're going to be taking some time to say, how do we educate people on what we do and how we help advance the economic envelope for the province, and along the way ensure that we're able to attract and retain great workers that can come in and help build a place. So
it's huge. You guys are looking at me on that. Yeah. it is extremely important. The thing is that associations and businesses and that sort of, they live the issue every day, right? And what happens at the legislature is once you become an MLA, you don't necessarily live the situation. You may have been in construction at one point in time, but you don't live it anymore. And you're a farmer, but you don't live everything that's going on anymore because you have another job. The collaboration and listening, again, I'm going to say it. The people who are coming to government and talking to them live the situation. Sure, there are opportunities to financially benefit. I mean, that's kind of part of the economy on that. But I don't think, at least in my experience, I don't think people are there to abuse the system. I think they're there to make it better.
Yeah, well said.
Or easier.
Yeah. Very good. Thanks, Joel. Sadly, I don't know if you can believe it, 45 minutes is almost coming to an end here.
Wow.
Already?
We're just starting to have a bit of fun. But does anybody have any closing thoughts that they'd like to depart with us and leave some everlasting wisdom to the viewers of Saskatchewan?
Wow, that's a big one. Do you want to start, Colin?
Colin, you're up.
No, I was going to say what you say. Just say you go.
I just hope a lot of people come out to vote.
Yeah,
right?
good point.
And that they don't take their vote for granted. There's a week to vote, and so no matter what, I hope people go out. And even if you're not sure who you're going to be voting for, if you don't feel like voting, still show up. And I think we owe it to our province and to our communities because some people are struggling and they need you to vote.
Yeah, absolutely.
I'd like to commend every person that's willing to put their name onto a ballot and say, I'm willing to put myself out there and bring new ideas, represent a set of people that feel that they want something better for their lives here in the province. And I think anybody who's willing to do that, they're not just a tip of the hat on there, but a big thank you for doing that, regardless of their personal outcome in this race, and regardless of who forms government and what that looks like. It's really critical, and when people do that, that's when kind of these new opportunities start to spring up.
Democracy works.
Yeah. And when people come out and actually vote and take the time and do it, like Chris said, you got a week's window. You can do whatever you can to try to do it.
It's almost sad to see that we in a democracy, half of us don't come out to vote when there's many societies around the world that would do
I just say, please don't take it for granted,
And you know what? Democracy is supposed to feel messy and unclear until that election day.
Yeah.
And then you put it away until the next time.
Yes.
Yeah. And so I thank people. I feel really blessed to be in a place that we can do this. And like you said, this is not how it is all around the world. So don't make that assumption. And I feel blessed, and I thank the folks that not just speaking tonight, but every candidate in the province that's putting their name out there. So,
Well said.
My parting comment is, you've got candidates coming to your door every day. You've got all candidates from all parties coming to your door. Engage them. Like we talked tonight that we didn't get a whole lot of answers. We kind of got platitudes and that sort of stuff. They're at your door. They're trying to win your vote. So don't hold back. Ask them what you think, what the plan is, how they're going to implement it. Then you can make an informed decision. And you can, I was thinking when we were talking earlier, it's an old political cliche, but it's hope beats fear. So like what you want to be able to do is you want to be able to make an election, hope for the best government you can get. So take the time to do that and take the time to make an informed vote. Then you'll get the government that you deserve.
Yes.
Joel, Chris, Colin, thanks again for your infinite wisdom, and thanks everybody throughout Saskatchewan for being with us this evening and talking about the healthcare debate. And upcoming is the Finance and Fiscal Responsibility debate. It'll be held at 8 p.m. on this very channel. And on behalf of the Regina District Chamber of Commerce, thank you for tuning in.
The Batoche constituency is located in central Saskatchewan. AccessNow communities located in Batoche are Aberdeen, Birch Hills, Cudworth, and Waka. The Battlefords constituency is located in western Saskatchewan, in the communities of Battleford and North Battleford. The Cannington constituency is located in the southeast corner of Saskatchewan. AccessNow communities located in Cannington are Arcola, Carlisle, Carnduff, Kipling, Lampman, Oxbow, Redvers, and Stoughton. The Kenora-Pelly constituency is located on the east side of Saskatchewan. AccessNow communities located in Kenora-Pelly are Kenora, Kamsack, Norquay, Springside, and Theodore. The Carrot River Valley constituency is located on the east side of Saskatchewan. AccessNow communities located in Carrot River Valley are Carrot River, Cadet, Hudson Bay, Nipawin, Tisdale, and White Fox. The Cumberland constituency is the northeast quarter of Saskatchewan. AccessNow communities located in Cumberland are Air-Ronge, Denair Beach, and La-Ronge. The Cut Knife of Saskatchewan. AccessNow communities located in Cut Knife Turtleford are Cochin, Lashburn, Maidstone, Meota, Unity, and Wilkie. The Cypress Hills constituency is located in the southwest corner of Saskatchewan. AccessNow communities located in Cypress Hills are Eston, Gull Lake, Leader, Maple Creek, and Shaunavon. The Dakota Arm River constituency is located in south-central Saskatchewan. AccessNow communities located in Dakota Arm River are Craik, Davidson, Dundurn, Imperial, and Outlook. The Estevan Big Muddy constituency is located on the south edge of Saskatchewan. AccessNow communities located in Estevan Big Muddy are Beanfate, Estevan, and Mydale. The Humboldt-Watrous constituency is located in central Saskatchewan. AccessNow communities located in Humboldt-Watrous are Allen, Bruno, Humboldt. The Kelvington-Wadena constituency is located near the east side of Saskatchewan. AccessNow communities located in Kelvington-Wadena are Foam Lake, Kelvington, Lanigan, Nokomis, Wadena, and Wynyard. The Kindersley-Biggar constituency is located on the west side of Saskatchewan. AccessNow communities located in Kindersley-Biggar are Biggar, Kerrobert, Kindersley, Luseland, and Mackland. The Last Mountain Touchwood constituency is located in southern Saskatchewan. AccessNow communities located in Last Mountain Touchwood are Earl Grey, Govan, Ituna, Raymore, Southey, and Strasburg. The Lumsden Morse constituency is located in southern Saskatchewan. AccessNow communities located in Lumsden Morse are Buena Vista, Lumsden, Pence, Regina Beach, and Rollo. The Martinsville-Blairmore constituency is located northwest of Saskatoon. AccessNow communities located in Martinsville-Blairmore are Dalmany and Martinsville. The Meadow Lake constituency is located near the west side of Saskatchewan and includes the AccessNow communities of Meadow Lake and St. Walburg. The Melfort constituency is located in central Saskatchewan. AccessNow communities located in this constituency are Kinistino, Melfort, Munster, and Watson. The Melville Saltcoats constituency is located near the southeast corner of Saskatchewan. AccessNow communities located in Melville Saltcoats are Bredenbury, Churchbridge, Esterhazy, Langenburg, Melville, and Saltcoats. The Moosomin-Momart constituency is located on the east side of Saskatchewan. AccessNow communities located in this constituency are Moosomin, Whitewood, and Wolseley. The Regina Coronation Park constituency is located in north-central Regina. Its boundaries are the city limits on the north, Winnipeg Street on the east, the CN Rail Line, Albert Street, and Avonhurst Drive on the south, and Argyle Street North, Carnegie Street, Partridge Crescent, Albert Street, and 12th Avenue North on the west. The Regina Douglas Park constituency is located in east-central Regina. Its boundaries are Ross Avenue on the north, Ring Road, the CPKC Rail Line, Park Street, and Arcola Avenue on the east, Wascana Lake on the south, and Broad Street, the CPKC Rail Line, and Winnipeg Street on the west. The Regina Elphinstone Centre constituency is located in central Regina. Its boundaries are the CN Rail Line, Louvain Drive, 3rd Avenue North, Avonhurst Drive, and Albert Street on the north, Winnipeg Street on the E line, Broad Street, 13th Avenue line, Broad Street, 13th Avenue, Elphinstone Street, and Saskatchewan Drive on the south, and Louvain Drive, Dewdney Avenue, Carlton Park, and Campbell Street on the west. The Regina Lakeview constituency is located in south central Regina. Its boundaries are 13th Avenue, the CPKC rail line, Louvain Drive, Saskatchewan Drive, and Elphinstone Street on the north, Broad Street and Wascana Lake on the east, 23rd Avenue, Scott Street, Jubilee Avenue, Bell Street, 25th Avenue, Campbell Street, and Hill Avenue on the south, and Courtney Street on the west. The Regina Mount Royal constituency is located on the west side of Regina. Its boundaries are the city limits and 9th Avenue North on the north, McCarthy Boulevard, 1st Avenue North, Campbell Street, Carlton Park, Dewdney Avenue and Louvain Drive on the east, the CPKC rail line, General Road, and Pinkey Road on the south, line on the west. The Regina Northeast constituency is located in northeast Regina. Its boundaries are the city limits on the north, McDonald Street, Prince of Wales Drive, the CPKC rail line and Tower Road on the east, Victoria Avenue on the south, and Park Street, the CPKC rail line, Ring Road, Ross Avenue and Winnipeg Street on the west. The Regina Pasqua constituency is located in southwest Regina. Its boundaries are Hill Avenue, Campbell Street, and 25th Avenue on the north, Montague Street, Gordon Road, and McTavish Street on the east, Kester Road and Highway 1 on the south, and Courtney Street on the west. The Regina-Rochdale constituency is located in northwest Regina. Its boundaries are Armour Road, Courtney Street, the city limits, and Highway 11 on the north, Albert Street on the east, Makowski Crescent, Abenchen Bay, Brock Bay, Juniper Drive, Lake Kennardine Drive, Cribbs Bay, Courtney Street, and 9th Avenue North on the south, and Courtney Street on the west. The Regina South Albert constituency is located on the south side of Regina. Its boundaries are 25th Avenue, Bell Street, Jubilee Avenue, Scott Street, and 23rd Avenue on the north, Wascana Parkway, Kramer Boulevard, Hillsdale Street, Parker Avenue, Hells Drive, Castle Road, Grant Road, Deer Grove Crescent, and Ring Road on the east, Shannon Park, Beechwood Place, Logan Crescent, Albert Street, and Walsh Street on the south, and McTavish Street, Gordon Road, and Montague Street on the west. The Regina University constituency is located in northwest Regina. Its boundaries are Victoria Avenue on the north, Prince of Wales Drive on the east, Fleet Street, Wascana Creek, Range Road 194, and the city limits on the south, Ring Road, Deer Grove Crescent, Grant Road, Parker Avenue, Hillsdale Street, Kramer Boulevard, Wascana Parkway, Wascana Lake, Arcola Avenue, and Park Street on the west. The Regina Walsh Acres constituency is located in northern Regina. Its boundaries are Blakeney Drive, Good Murphy Bay, Mawson Bay, Davy Bay, Hampshire Place, Cook Crescent, Hopkins Crescent, Rowell Crescent, Stanley Crescent, Gary Street, Dryburgh Crescent, Sanderson Crescent, Price Crescent, French Crescent, Craigie Bay, Roulette Bay, Jackson Bay, and Triffanoff Crescent on the north, Argyle Street North on the east, 3rd Avenue North, Louvain Drive and the CN Rail Line on the south, and Campbell Street, 1st Avenue North, McCarthy Boulevard, 9th Avenue North, and Courtney Street on the west. The Regina-Wascana Plains constituency is located on the east side of Regina. Its boundaries are Victoria Avenue, Tower Road, and the City AC Rail Line on the east, Arcola Avenue, Chuka Creek and the city limits on the south, and Prince of Wales Drive on the west. The Rosetown-Delisle constituency is located in west central Saskatchewan. AccessNow communities located in this constituency are Delisle, Langham, Rosetown, and Vanscoy. The Rostern-Shelbrook constituency is located in west central Saskatchewan. AccessNow communities located in this constituency are Glassland, Hefford, Rostern, Shelbrook, and Spiritwood. The Warman constituency is located north of Saskatoon. AccessNow communities located in this constituency are Hague, Osler, and Warman. The Weyburn-Bengoff constituency is located in southern Saskatchewan. AccessNow communities located in this constituency are Milestone, Weyburn, and Yellowgrass. The White City-Capel constituency is located east of Regina. AccessNow communities Oni, Copper Sands, Emerald Park, Fort Capel, Canucama, Pilot Butte, and White City. The Wood River constituency is located on the south side of Saskatchewan. AccessNow communities located in Wood River are Coronach and Gravelburn. The Yorkton constituency is the city and surrounding area of Yorkton. To find out which constituency you live in or to check if you're registered to vote, call 1-877-958-8683 or visit elections.sk.ca.
Watch Planting Seeds, Philanthropy in Saskatchewan, a show where we aim to connect you to the community impact being powered by donors and charities across the prairies. Join me, your host, Victor Roman, with the South Saskatchewan Community Foundation, and I hope you enjoy the show.
Huh, I wasn't expecting an email about an unpaid bill.
This sounds like a phishing scam. The fraudulent practice of tricking you into giving away sensitive information that could compromise your online and financial accounts. Phishing scams can come in the form of emails, text messages, or phone calls that appear to be from a legitimate source.
Be suspicious when there's urgency in the email, unfamiliar sender, suspicious links, and also suspicious documents attached.
Learn more at myaccess.ca/cybersecurity.
Hi, I'm Colin Puller with the Bald Leadership Podcast. Listen and laugh as we learn from leaders making impact in Saskatchewan. Watch on AccessNow TV. And don't worry, you don't have to be bald to enjoy it.
AccessNow Sports. Full game coverage, expert commentary, news and interviews from your favorite Saskatchewan teams. Follow the action. Watch AccessNow Sports. Brought to you by the Capital Automotive Group.
Hurry, hurry, hurry to the greatest auto sale at Capital Weekly Ringmaster Specials. Bring the whole family down for food, games, and your chance to win thousands in amazing prizes.
Break free from traditional TV with Access Next TV Stream. Find all your live TV channels and streaming apps in one place. Watch live or recorded shows at home or on the go with the Next TV Stream app. Catch up on programs from the past 3 days, even if you forgot to set them to record.
There's the shot score!
And record and save your favorite shows in the cloud. Watch TV your way for as low as $9.95 a month with Access Next TV Stream.
The views, information, and opinions expressed during the following program are solely those of the individuals involved and do not necessarily represent the views of Access Communications, its representatives, or its employees. Live debate coverage is brought to you by the Saskatchewan Realtors Association, the Regina and Region Home Builders Association, the Regina Hotel Association, and APAS.
Good evening and welcome to Decision 2024, Our Province, Our Vote. My name is Lisa Peters and I will be your moderator for this debate. This evening is being brought to you by the Saskatchewan Realtors Association, the Regina and Region Home Builders Association, the Regina Hotel Association, AccessNow TV, and the Regina District Chamber of Commerce. In preparation for this evening's debate, draws were made for opening comments, closing comments, and podium position. Our topic for tonight's debate will be fiscal responsibility. I would now like to introduce to you the candidates for this evening's debate. At podium number 1, we have Donna Harpower, Saskatchewan Party. Podium 2, Trent Weatherspoon, Saskatchewan NDP. Podium 3, Rose Bushell, Progressive Conservative Party of Saskatchewan. And podium 4, Remy Rowe, Saskatchewan Green Party. All right, we'll begin with our opening comments. And our first opening comment will go to Donna Harpower. Donna, you have 2 minutes.
Thank you, and thank you to the Regina Chamber for hosting this forum. The choice in this election is clear. Who will keep our economy strong and our future bright? That's the ballot question. And that's the choice voters will make between the Saskatchewan Party and the NDP. Tonight we will have a chance to compare plans and to compare records. The debate tonight is on fiscal responsibility, and the Saskatchewan Party record is one that we're proud to run on. Today, Saskatchewan has the second lowest debt-to-GDP ratio of any province in Canada because of the Saskatchewan Party government's strong fiscal management and a growing economy. Saskatchewan has the second highest credit rating among the provinces. And the Saskatchewan Party government has retired $2.5 billion in operating debt over the last 2 years. Our strong finances allow us to make investments into Saskatchewan people and to make your lives more affordable. Saskatchewan is the most affordable place to live in Canada and to live. But we know Saskatchewan people are feeling cost of living pressures, just like everywhere else. And that's why your Saskatchewan Party government delivers over $2 billion in affordability measures every year, year over year. And that's why we took the Trudeau NDP carbon tax off of your home heating bill. We are going to do even more to keep life affordable in Saskatchewan for every single resident. If we're re-elected, Saskatchewan Party government will make life more affordable by delivering the largest income tax reduction since 2008, saving a family of four $3,400 and a senior couple $1,100 over the next 4 years. We're going to make life more affordable for students by increasing the graduate retention program by 20%. And we're going to make life more affordable for families by doubling the active family benefit. Which brings me to the record of the NDP, a record of decline. The NDP had the worst job creation record in all of Canada, losing people, jobs, and opportunities. So tonight, ask yourself, which party has a plan to keep our economy strong and our future bright? Thank you.
Thank you, Ms. Harpower. Ms. Rose Bushell, you have podium next, opening comments.
Thank you again, Lisa, and good evening, everyone. So tonight we're talking about fiscal responsibility. It's no secret that for a province to thrive, its government needs to be wise stewards of the public purse. After all, the role of government is representing the interest of people to the best of the ability. In truth, a lot can be said about a person by how it treats the people they claim to represent. There's no doubt that the current Sask Party government has simply not been wise spenders of your money. 17 years in power, 16 of those in which we ran deficits, only one balanced budget. A debt surpassing $30 billion, that is $25,000 for every man, woman, and child in this province, above and beyond what you're already being taxed. This is not allowable, and it should not be acceptable. And what do we have to show for it? Healthcare and education are in a crisis, dirt roads pretending to be highways up north, and hints of personal scandal among our ruling members of legislature. But it does not have to be this way. Waste can be cut. Mega projects can be reviewed, and scandals can be curtailed. Revenue can also be increased with more prudent guidance. It is not impossible. And this is what the Progressive Conservative Party of Saskatchewan can offer, a common sense approach to fiscal responsibility, one that can balance cuts with increased revenues, and it will be done. This is why when you go to vote, you need to vote for the person, the candidate, and the party to ensure that the government that comes into power will be responsible for your taxpayers' dollars. We are in a position this election to see change, a change in this province that everybody is calling for.
Thank you, Ms. Bushell. It now goes to you, Mr. Rowe. You have 2 minutes.
Thank you. Merci, everyone that is here in the studio, my colleagues, and all of you people out there in Saskatchewan. Fiscal responsibility is about being accountable to you. Don't forget, this is your money. So if you get people who don't know how to be frugal and spend ridiculously, you're going to end up paying more. It's time to rearrange our fiscal responsibility, be accountable to you, open the books to the public if we have to. It's time for you to actually realize what we're doing with your funds. Not our personal funds, because it's not ours. I pay taxes the same as everybody else does. What are they doing with our money? Are they willing to actually turn around and address poverty? Are they willing to turn around and make a better lifestyle for the people of Saskatchewan? Or are they just spending it on mega projects and on a healthcare system that doesn't even work? They close down roads. They take away our connectivity within the province. They remove the Saskatchewan Transit Commission. They make things that are isolated in the people of the north, especially for the First People of Turtle Island. It's time that we actually stood up and be accounted for. Let us be your voice. They're not going to fit everybody into the legislative building, because if they could, I'd ask everybody from up north to come here and talk. But it is time that we change things. It's time that we forget what has happened and plant seeds for the future, for tomorrow's generation. We got 7 generations we got to think about. If we do the right movements now, we can build upon the treaties and we can work together.
Thank you, Mr. Rowe. All right, Mr. Weatherspoon, opening comments. You have 2 minutes.
Well, good evening. I'm very pleased to be here again tonight with Access, the Chamber, and my fellow candidates. I'm really excited to talk about our provincial finances, the Saskatchewan NDP's fiscal plans, and our plans to build our future. We've released a fully costed framework for the next 4 years. We're making serious investments in the areas people really care about: healthcare, education, cost of living, and community safety. Unlike the Sask Party, we're not raising taxes. In fact, we're cutting taxes to make life more affordable. Taking the PST off kids' clothes and groceries, and pausing the fuel tax to give you a break at the pump. A suspension of 15 cents a litre on day one of a new government, saving families dollars before Christmas. We're eliminating the waste, corruption, and mismanagement of the Sask Party. All that, and we're going to balance the budget. We have a rock-solid fiscal plan signed off by a respected economist and former Deputy Minister of Finance. Meanwhile, what has the Sask Party got to show for 17 years in power? Hospitals and schools overcapacity and failing all around us. Multi-million-dollar projects that have gone sideways. Hard-earned public dollars wasted, with contracts handed out to out-of-province and out-of-province companies, shutting out our province's workers and companies. Deficit after deficit after deficit. A debt that's doubled under Scott Moe, a debt that's quadrupled under the Sask Party. That's their record. It's time for change. And Carla Beck, the Saskatchewan NDP, are ready to deliver.
Thank you,
to make
Mr.
life more
Weatherspoon.
affordable.
All right, we're going to move into our debate, and the topic for this evening is fiscal responsibility. Our first question is on budget prioritization. What criteria will you use to prioritize spending in the provincial budget to ensure essential services are funded while also promoting growth? This first question will go to Donna. You will have 1 minute.
Thank you. Every budget is viewed through the lens of creating an environment that will sustain the existing economy while facilitating and encouraging new growth. That's competitive taxes, royalties, incentive programs, and more. Only through economic growth can a government maintain and sustain quality services. And as for prioritizing those services, government members choose what the priorities will be each and every year for each and every budget. At the beginning of that process, the decisions made on what we hear from the public, and we know that there is always more work that needs to be done. There's competing good ideas more often than competing bad ideas. But you have to weigh, you have to balance this within the fiscal capacity of that given year. So for example, this budget, our priorities was classrooms, care, and communities. Balance is the key, but the lens must first go on growing the economy, because only through the economy can we continue to expand and sustain services.
Thank you, Ms. Harpower. All right, Mr. Weatherspoon, you have 1 minute.
Well, clearly the priority needs to be in response to the situation people face. So our one priority is to deliver cost of living relief for Saskatchewan people. On day one, we'll act to suspend the fuel tax. We'll act to cut the PST off kids' clothes and groceries, something that was added, the PST was added to by the Sask Party. And then we will work tirelessly to build back healthcare and education in this province. Those are our priorities: cost of living, healthcare, education, and building an economy that's creating jobs that families can count on. When we look at the deployment of public dollars, we have to stop the mismanagement, the waste, the corruption. We need to get true value for money for Saskatchewan people, investing them in ways that will create opportunities for our future generations.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
When it comes to the budget, the first thing we have to do and we have to look at is we are going to have to start looking at some of these mega proposed projects and get rid of them. We need to put them on the shelf. These are not sustainable for our economy. The next thing we need to do is we need to fully open the books with a forensic audit, not just on everyday dealings of the government, but crown corporations. We have been lied to. We are being lied to constantly every day. We are not being told the exact nature of our debt. And this is scary. And until this is done, the main focuses that we have to focus on is affordability, healthcare, and education, and get rid of these vanity mega projects that the Sask Party currently has in place.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
So, fiscal responsibility. I don't know if how many people know rich people that actually help you. You need somebody that actually knows how to stretch a dollar so that it actually acts in your behalf as 10 bucks. I looked at the numbers. I look at all the deficits that they've been running. I lived here in 2002. I moved away. I came back. My mom stayed here right straight through from 2002 to 2024. So what was happening in Saskatchewan was of major concern to me when you have an 80-year-old person that you're looking after. We don't look after our people. We don't invest in them. So one of the things we need to do is actually do that forensic audit, and I'm going to agree that needs to be done. But we need to start looking and addressing poverty within our communities, education, healthcare, and we need to turn around and invest into the people of Saskatchewan for Saskatchewan. So it's got to be Saskatchewan first.
Thank you, Mr. Rowe. All right, we'll move into debt management. How do you plan to manage provincial debt while ensuring their investments in growth and infrastructure are maintained? This question goes to you, Mr. Weatherspoon. You have 1 minute.
It's a very important question. In Saskatchewan, we've said we don't have a revenue problem. We have a management problem, or a mismanagement problem, I should say, with the Sask Party. We've seen that with the government that has piled on and quadrupled the debt in their term, a premier that's doubled it. We have, of course, our operating debt, our capital debt, and then as well our crown debt. And then we have all the other debt that's accumulated through our P3s and the awful mismanagement of this government. It has to be about getting value for money. It can't be about making choices today that tie the hands of future generations. We have to be able to live within our means and get value for money. You know, when I look to projects like the Regina bypass that was mismanaged in such a horrible way, wasted over $1 billion, shut out local companies and workers, sending those jobs and money to a company from France. We have to do better than that.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
So the first thing when it comes to debt management, what we have to look at is axing these mega projects. We've got the Marshal Service that is proposed and going ahead with the Sask Party. This project has already cost $7 million, and we've seen nothing from it. This is a project that will continue to cost the province $20 million a year on top of what was already spent. These projects cannot continue without being sourced out properly, researched properly, and made sure they were cost effective. We need to make sure that the money we spend it wisely. We need to put it into healthcare, we need to put it into education, and we need to make sure life is affordable for everyday people of Saskatchewan. This is something that the Sask Party has been out of touch with for so many years.
Thank you, Ms. Bushell. Mr. Rowe.
Thank you. I hear that this is a revenue-generating province and that we do have a mismanagement, and I am going to agree with my esteemed colleague, but there is a problem with that revenue. We don't charge enough. Our oil is being sold cheaper than anywhere else. We need to actually look at the budget, look at our revenues, and turn around and bring things back into perspective. It's the only way that we're going to be able to invest in Saskatchewan people. It's the people that actually are the ones that pay for this, and we need to give them an opportunity to have that investment go back into their pocket. So Saskatchewan first, addressing poverty, creating jobs, bringing in manufacturing, and building up the Saskatchewan province to a bigger and better economy for the next 7 generations.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
Thank you. We have 3 types of debt in this province. One is the Crown Corporation debt, which is similar to a business debt, where the rates that the Crown Corporations charge help them manage their debt in a business manner. We have a capital project debt, which is debt on one-time capital projects. So it's a one-time expenditure, and you can compare that to a mortgage. We invest in sinking funds to help with future debt payments. And we have the operating debt, which is the one that kind of keeps me awake at night, because there is no mechanism to make that payment unless you bring your revenues up. So I am very proud to say over the last 2 balanced budgets, and it's not me saying, it's the provincial auditor that said that they were balanced budgets, we were able to write down that operating debt by $2.5 billion, bringing it down to a more manageable level. However, we need to look at the indicators. I know that there's gloom and doom from other members we've heard, but the fact is the credit rating agencies rate Saskatchewan's fiscal management very, very high. We're the 2nd highest credit rating in the country, and we have the 2nd lowest debt to GDP.
All right, we're going to move on to economic growth strategies. What specific policies will you implement to stimulate economic growth without compromising fiscal responsibility? This goes to you, Ms. Bushell. You have 1 minute.
Thank you so much for the question. When it comes to stimulating economic growth, there is a number of things that we proposed in our affordability plan. These measures will make things more affordable for people in Saskatchewan. One of the first things is that we are looking at food sustainability and food security. This is something on the minds of a lot of people in Saskatchewan. We will work on building greenhouses to make sure that there is affordable fruits and vegetables for people of Saskatchewan. We can do this at a lower cost than importing what we currently are. We currently have the Shan Power Station, which at one time was just used for growing trees, the greenhouse there. Now I believe that is sitting empty. We can be using this to start producing affordable food. On top of that, and this is an initiative that will pay for itself. On top of that, another initiative that will pay for itself is we are looking at building 5,000 homes. These 5,000 homes will be a rent-to-own. At the end of your term, that home is yours, free and clear. But the money that you pay will now pay for the home.
Ms. Bushell. All right. Mr. Rowe, you have 1 minute.
So how do we build our people? We invest in them through education, transitional training to go from fossil fuels to renewable resources. We start building factories here in Saskatchewan to actually make things instead of shipping out our raw materials to another country or even another area. And most of our raw goods go out of Canada. It's time to look at our own house. You cannot help another person until your house is in order. And honestly, the house in Saskatchewan is not in order. We need to start taking control of what is going on as people of this province, and we need to invest into our people from the north. We have people that are First Nations that have better degrees and more experience than even the people in Regina. It's time to start working together, empowering the treaties, and building a better province.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
Thank you. The Saskatchewan Party has a growth plan, unlike the previous NDP government, which when they attempted a growth plan, we lost population each and every time. We set targets in our growth plan, many which have been met and surpassed, and we constantly revisit that growth plan. We believe that fiscal responsibility is an important consideration for economic growth because outside investment looks for a jurisdiction that is fiscally stable. They look for a skilled workforce. They look for affordable utilities. They look for needed infrastructure to support their industry. They look for competitive tax regimes, and they look for quality of life for their workers. That means affordability, that means housing, and that means services. And so with each and every issue that outside private investment is looking for is what we review with each and every budget to see if we can meet the needs and attract as much investment to our province as possible through economic growth. We'll have a brighter future.
Thank you, Ms. Hartpower. Mr. Weatherspoon, you have 1 minute.
Well, the economic reality is that Scott Moe has stuck Saskatchewan's economy in last place in Canada by way of jobs and growth and so many other measures. And he's imposed so many taxes and costs that have hampered the economic environment and our competitiveness. In our platform, we've committed to firing up our economy and creating jobs. We've done so with measures around an economic growth initiative, a commitment to make sure that we're supporting value-add agriculture and mining and forestry, that we're making sure that we that we deal with the PST that was stuck on those investments by the current government. That's a disincentive. We need to secure those investments. Unlike the current government, we won't be doubling the small business rate. We're going to be freezing it at 1%. And of course, we'd need to deal with cost of living, healthcare, and education, because without building those up and making life more affordable, we're not going to be able to build our economy.
Thank you, Mr. Weatherspoon. All right, we're going to move to secondary suite incentive, and candidates will be asked a question that has been recorded in advance by Stu Niebergall of Regina and Region Home Builders Association. Let's take a look. Listen.
The secondary suite incentive has been popular and helpful for those who are trying to attain home ownership while gently increasing rental units within neighborhoods. It's also a great program for supporting multi-generational families and supporting those looking after aging parents. The program ends in a little over a year. Is it time to make this program permanent?
The first question goes to you, Mr. Rowe. You have 1 minute.
Well, again, here we go back to being, if you want to calculate the wellness of a province, you calculate how happy the people are. So we're not very well. Caring about people, family, second suites, absolutely. It is a great concept to actually help with the housing crisis, but that doesn't mean we have to stop. It does need to make sure that it is going to be a safe environment for people, but we should still be building intergenerational housing in all communities, including those up in the north, on the reserves, outside the reserves. Get the people not to be so centralized, but be able to use the entire province. We've got a wide area, and we can actually use it properly. We can still grow our grain, we can still help the people, and we can still, as they want to do, drill, instead of using renewable resources. But it's all there for us. We just need to have some faith as a government in the people, and the people need to have faith and hope of their government.
Thank you, Mr. Rowe. Ms. Hartpower, you have 1 minute.
Thank you. And this is a program that I was very proud to bring forward fairly recently to address the very same issues that Stu just mentioned. I want to thank the Realtors Association, the Saskatoon and the Regina Home Builders, and the Rental Association for the collaborative work that they do with government. These programs are not designed in isolation. They're designed while working with the actual boots on the ground or with the industry. So although it won't be a platform promise is to make that a permanent program, I am sure it will be reviewed with each and every budget whether it needs to be extended and made a permanent program. It was needed at the time that we announced it. I think it's still needed today.
Thank you, Ms. Hartpower. Mr. Weatherspoon, you have 1 minute.
Well, I want to thank Stu as well for the really good question, and the home builders and the realtors for the question and for their work on this front. It's exactly the kind of program that needs to be reviewed and ensure that it's delivering in the way that we need to and having those outcomes That's the way we would approach this as a government. We see the challenges around housing, and obviously we need to make sure that we have accessibility to rental units and that new homeowners can access housing. We know that this whole environment was really devastated by the Sask Party government, and they stuck the PST, of course, onto construction labor. It was a real gut punch to growth and affordability, which is why we're also so focused on making life more affordable by cutting the fuel tax on day one, getting the PST off kids' clothes and groceries. On housing as well, we also need to manage our housing units, 3,000 units, Saskatchewan housing, that need to be deployed. Right now they're sitting empty and we're paying for them.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
Pardon me, the secondary suite incentive is actually very important, and it has helped so many people in Saskatchewan. I think it's important to note that in order to keep this program going, we also need to make it affordable. Right now, with the current cost and taxes, this is something that a lot of people can't do. And it's important, if we want to keep this program going, we make it affordable for them. One of the things that we will push to do is have PST removed off of building materials as well as labor. This will help people develop that second suite. This will help to bring families together. And because of that, we really support this program and think it should be something that is permanent within our future budgets.
Thank you, Ms. Bushell. We'll move on to revenue generation. How do you propose to diversify revenue sources for the province to reduce reliance on traditional funding methods? This first question will go to Ms. Harpower.
Thank you. We have three significant sources of revenue, and one is taxes, the second is resource revenue, and the third is federal transfers. It's just that simple. There is only three major avenues. So that is why I can't stress enough, and have in previous answers, of why we need to attract investment, which then becomes a major taxpayer without raising taxes. You grow the economy, then you have that revenue that's sustainable. Along with reviewing the things that I have mentioned previously, such as having a skilled workforce and affordable utilities and the needed infrastructure that industry is looking for, along with all of that, we believe that there needs to be incentive programs that will bring forward specific industries, but we also need to tell the Saskatchewan story to the world. We believe strongly in the power of global outreach, be that trade missions and trade offices. And it's very disappointing to have the official opposition, the NDP, not support those trade missions and not support the trade offices.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
Well, we'll stick to the facts here today. I'll answer the question about revenues. What we really need to do here is get this economy fired up. Scott Moe and the Sask Party have stuck us in last place during his tenure in all of Canada, and that's on jobs and economic growth and building permits, and that's not getting it done for Saskatchewan people. So what we need to do is make sure that we're creating conditions for investment to be secured, for projects to move forward, for more people to be working. What we shouldn't be doing is what we see with the Sask Party, outsourcing public project after public project outside of Saskatchewan, often outside of Canada. We need to make sure that we're building opportunity here for Saskatchewan companies, Saskatchewan workers who have the ability to get it done, and we know it's in our interests when they're here. We know we don't have a revenue problem in Saskatchewan. It's one of waste and mismanagement. We look at the Marshal Service, the bypass, the Saskatchewan Revenue Agency, AIMS. I could go on and on in ways this government wastes dollars.
Ms. Bushell, you have 1 minute.
So funding methods, we do not have a funding problem in the province. We generate over $2 billion in PST alone. There is provincial income tax that is paid. We do have a problem with mismanagement, but we also have a problem with the economy not growing because there isn't jobs. These jobs aren't there because the Saskatchewan government is not investing in businesses or people of Saskatchewan. And this is where we need to start looking at. Furthermore, what we need to do is we have to make sure that we cooperate and work with the federal government, as well as talk to all the other premiers of the province to make sure we start getting our fair share of equalization payments. There is no reason why we get nothing, but this is what we're getting.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
Thank you. So we need to create jobs, and we've got to start looking at getting away from the whip and buggy, which is now known the car and the fossil fuels, and start getting into renewable resources and start training people. That'll start creating jobs. Start closing off some of these orphan wells that are within Saskatchewan. There are 600 orphan wells in Saskatchewan, and out of that there are 36,000 inactive wells. If we can start cleaning that up, we can start creating 10,000 jobs. And those are the numbers. We can sharply increase mandatory payments by polluters who leave orphan wells in our province. We can generate a third, fourth, and fifth source of revenue by doing the right things, by changing the way we think, and by actually making major changes in this province. It's time.
Thank you, Mr. Rowe. All right, we will now move into our candidate-to-candidate questions. Each candidate will be given 20 seconds to ask a question to whomever they choose. The candidate that has been asked the question will have 40 seconds to respond. The first candidate-to-candidate question goes to you, Mr. Weatherspoon.
Well, my question is for Ms. Harpower. The past two elections, your party has promised to cut taxes. Well, that turned out to be a lie. Your party broke that promise, and shortly after the election 2 times ago, brought the biggest tax hike in Saskatchewan's history. Promised again in the last election, then imposed 31 new taxes and fee hikes.
Please ask
your
question.
How on earth would any Saskatchewan person trust your promise this time?
We have managed to significantly reduce the personal income tax within our time in government and remain among the lowest personal income tax in the country. We also have the lowest provincial sales tax in the country, with the exception, of course, of Alberta, which doesn't have a sales tax. So we have managed to keep our taxes low and competitive throughout our term in government, and we are proud of that record, and we will stand by it. And through that, we've been able to sustain very strong funding for our public services.
Thank you, Ms. Harpower. Our second candidate-to-candidate question will go to you, Ms. Bushell. You have 20 seconds.
Trent, this is a question for you. And this is a simple question. Will you be committed to working with PC government members in the legislature to make sure that we open the books completely so we know the exact financial state of this province?
We certainly would work with, if there were PC members there, we would work with anyone in the legislature to get to the bottom of the mismanagement, the corruption, the scandal, the wasted dollars, and work to get value for money on so many of these deals that have been inked that have wasted dollars and tied the hands of future generations. We have so many outstanding questions as it relates to the big ripoff that was the Regina bypass, the $1 billion overrun, and getting to the bottom on that front, as well as the GTH land deal. And then so many other contracts where the Sask Party has chosen an approach that costs the taxpayers of this province far more than it should, often lining the pockets of friends and insiders.
Thank you, Mr. Weatherspoon. Our next candidate-to-candidate question goes to Mr. Rowe. You have 20 seconds.
Trent, I've got a question for you. You know there's a waste of money, and they're wasting more money by trying to push SMRs. And if people don't know what SMRs are, small nuclear reactors within Saskatchewan that will pollute our lands, pollute our water, and destroy crops. Will your government make a commitment today to cancel it? No SMRs, no nuclear in Saskatchewan, whether north or south.
We believe that decisions around power generation in this province are going to be incredibly important because we need to make sure we have stable power, affordable power, and that it's sustainable. And we are fully open to considering SMRs. And we have a very important uranium industry in this province. But what we're talking about here has to have proven feasibility, and we have to know the costs. And frankly, this is something that we just can't trust the Sask Party with. Projects, whether they be small or large, have gone sideways under this government, dollars wasted. We can't trust them with the big decisions about power generation. We think all options should be on the table, and we need to make the decisions for the right reasons and value for money.
Thank you, Mr. Weatherspoon. All right, Ms. Harpower, you can ask your question. You have 20 seconds.
Thank you. Mr. Weatherspoon, considering your platform crossing document doesn't include the cost of all of your party's promises and only accounts for a fraction of your education and healthcare promises, leaving a $3 billion hole unaccounted for, why should the people of Saskatchewan trust your party with managing the finances of the province?
Well, the question just doesn't line up with the facts. The platform, of course, has been fully costed and led by Deputy Minister Ron Stiles, who delivered balanced budget after balanced budget with the previous NDP, and then went on to lead under your government as CEO of Crown Investments Corporation and SaskTel. Our commitments are there and have us back to balance. And, frankly, the Sask Party has no credibility on this front. Quadrupled the debt, more than doubled the PST, taking now more than $1,000 more each and every year from the average family. Missed in the last 4 years the budget forecast by $9 billion. Promised not to cut taxes and then jacked up taxes after both elections in a historic way.
Thank you,
There's just
Mr.
not credibility
Weatherspoon.
on this front.
All right, we're going to move to collaboration with the private sector. How will you engage the private sector to foster economic growth while managing public funds responsibly? We will start with you, Ms. Bushell.
Well, thank you for the question. So one thing we need to do is that we need to really invest in people and the private sector. And when I say the private sector, I'm talking about whether it be housing, education is public, so it should never be private, as well as healthcare. But we need to start talking to businesses. We need to start giving incentives for them to give them the opportunity to grow. This is what's important to make sure that we have economic growth. We will also invest in people to make sure that they have the incentive to start their own businesses. Businesses that were made in Saskatchewan by Saskatchewan people that will remain in the province and not be closed down by a government who has no problem bringing in American contractors and businesses, which will shut down a Saskatchewan company.
All right, thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
So again, it's all about investing into the people in Saskatchewan. Yes, bringing in an incentive program for people to actually start their own business, start being competitive within Saskatchewan, and start building our economy. There are ways we could do that. Again, it's about reallocating of the funds that we are already paying into these governments that have been before us and reallocating it properly into the usage for Saskatchewan people. You cannot build an economy by living in debt. You can build an economy by bringing the wellness of life and a possibility and hope for the future to the people that are presently here. If you can't understand that, look at our history. I'm a strong history buff. Look at the history of Saskatchewan. We were once a very prosperous province. And then something happened. And they're all both sitting over at that end of the podiums. Both governments are to blame. You cannot build good things off of bad policies. You need to build a new foundation.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
Private sector engagement is critical for our province, and the way in order to have the private sector engaged is to have an open door policy, which means ministers need to be available and accessible. So virtually all of our incentive programs for industry were designed with industry. And for fiscal stability, most of our incentive programs are designed to encourage and facilitate new growth. So the interested industry will only benefit from the tax incentive over a period of time if it is new growth and it establishes here in Saskatchewan. This approach has encouraged a lot of private sector investment, record dollars of private sector investment in Saskatchewan that was looking at a number of locations, but through the engagement with government and being able to work together has chosen Saskatchewan in order to invest.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
Well, the Sask Party is squandering opportunity and getting in the way of the growth that we need on this front. We've been in last place under Scott Moe and the Sask Party on growth and jobs. We need to fire up investment and job creation that people can count on. which is why we've committed to the economic growth initiatives that deals with the job-killing PST that was imposed by the Sask Party, and make sure that we can expand and secure investment in value-add ag, mining, forestry, and so much more to revitalize our main streets. We also won't be doubling the small business tax rate as the current Sask Party, as we know how important these entrepreneurs are, these job creators across Saskatchewan. We've put in place a small business loans program to again create opportunity and create jobs to revitalize and strengthen our economy. And we won't outsource the projects, public projects with public dollars outside of Saskatchewan to companies outside the province and out of the country. We will prioritize Saskatchewan workers and Saskatchewan companies. We'll always work to make sure we're maximizing value for money, ensure that Saskatchewan people have the accountability they deserve as we get this economy
Mr.
building.
Weatherspoon. All right, we're going to move to cost-cutting measures. What areas do you identify for potential cost-cutting within government operations? And how will you ensure these do not impact service delivery? This first question will go to you, Mr. Rowe.
Again, it's all about looking at what we're doing, looking at how we got to where we are, and what needs to be changed in order to move forward in a very solid fashion. We need to cut the fat. The administrative cost is just ridiculous. I mean, you talk about small business loans, try to apply for one. You talk about trying to help the people, and yet you put so many hoops into the way that you're not actually helping, you're just creating more administrative layers. This is an onion that we need to peel, and we got to take it off layer by layer until we get to the root of the issue, and then rebuild from there. Start a whole new foundation, start building up the province, and start helping the people.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
Thank you. Responsible governments should be looking for expense efficiencies in each and every budget, as well, not only when the budget is being drafted, but mid-year or later in the budget year, they should re-look through a lens of finding efficiencies. A budget is only a projection. You are projecting what your revenues will be and what your expenses will be for the next 12 months. If a ministry finds that it does not need the funds that it has been budgeted or allocated, governments need to review those funds, see if they can be reallocated to a program that is short on the funding that they projected, or return to the GRF. This is an exercise that should be undertaken by every responsible government each and every year. Although I don't agree with the list chosen by the NDP in their document, in their costing document, such as the trade offices reduction and the Marshal Service, I do agree with the concept that this needs to be done. It needs to be reviewed. All programs should be reviewed. Look for efficiencies. Is it effective? Is it cost effective? And that is...
Ms. Harpower.
Thank you.
Mr. Weatherspoon, you have 1 minute.
Well, the situation we face here is that we really have mismanagement, waste, and corruption that's off the rails in this province right now. This tired 17-year-old government has wasted dollars hand over fist day in and day out. And so as a first order of business, we'll be opening up the books, and we'll be working and investigating and acting to ensure value for money on every front, making sure that we stop squandering public dollars. As for the list is long, and it's small and it's large. You know, $1 million, extravagant travel to Dubai, whether it's the Saskatchewan Revenue Agency that would actually waste $250 million of both public money and small businesses' money over a decade. It just makes no sense. Or the bypass, the GTH, contract nurses from out of province that we're now spending over $100 million on when they're paying taxes in other jurisdictions. On front after front, there's so much waste to cancel.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
So the first order when it comes to cost-cutting measures is we need to get rid of these mega vanity projects. This is going to be the most important thing. Does another member of the legislature really need their name on a building? They don't. But what we can do is look for the long term. There's so many projects that are upcoming within the Sask Party that we can look at getting rid of. Regina Bypass, which was built, which has cost taxpayers over $2 billion and will continue to cost generations millions of dollars just for maintenance. Well, now they're looking at the same thing in Saskatoon. Not only will this bypass in Saskatoon be a huge road construction project that will cost over $2 billion, they've already spent millions on this project and nothing has come out of it. This will also greatly impact environmental areas which are already fragile. Finally, we got to look at the Saskatchewan Revenue Agency. This is just a duplicate of the CRA. I need a bureaucracy, and we can't even put a price on that because it hasn't been fully costed.
Thank you, Ms. Bushell. All right, we are now going to go to agricultural financial pressures. And our next question has been recorded in advance by Bill Probilski of the Agricultural Producers Association of Saskatchewan. Let's have a listen.
Agriculture is a major driver of Saskatchewan's economy, but it also faces financial pressures from unpredictable markets to rising input costs. How will you provide the necessary supports for our agricultural sector without increasing taxes on Saskatchewan residents?
All right, well, this first question will go to you, Ms. Harpower.
Thank you. Very quickly, twofold is supporting the programs that are in place that are available to our agriculture producers. We have had, time again, very strong agriculture ministers here in Saskatchewan whose voice carries weight at the federal, provincial negotiating tables when we negotiate the national programs. We've been able to enhance those programs, and I have to say that our Minister, Dave Merritt, has been there for our producers whenever there is a crisis above and beyond what the programs are addressing. Second is, I think it's critical to agriculture, and go back to the trade missions that we have promoted and increased, and the trade offices, because agriculture is very dependent on the global market, not just the domestic market. So that is another way that we have, and we will continue to support our agriculture sector.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
Agriculture is so vital to our province today and to the future and to the world, and it's world class. But we need to make sure the foundation is there and the backstop is there to make sure that it can thrive into the future. We need to improve business risk management programs for producers, specifically the livestock producers deserve equity with a backstop. I think of livestock price insurance and other programs that could bring improvements. Right now, they don't get contributions from the province or the federal government and don't have the backstop that they need and deserve. Livestock producers also deserve meat pricing fairness. Right now we have out-of-province meat packers that don't provide that. It prevents producers from getting the fair price on live cattle, and it makes consumers pay through the nose as well. We have to address those anti-competitive behaviors. We need to act to make sure we have transportation that works for producers. All too often it's the other way around, and we need to lean into that. We need to compensate producers for their role as stewards of the land when we think of native prairie and grasslands.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
When it comes to supports for agriculture without raising taxes, what we need to do is have the supports in place for Saskatchewan farmers. Saskatchewan farmers are paying way too much money when it comes to fuel. They're paying too much input costs. They're paying too much in crop insurance, and they're not getting a fair shake. One of the biggest problems when it comes to farms in Saskatchewan is to make sure they can get their products to market. And this is why we would look at making sure that we could use and ship through the Port of Churchill in Manitoba. This alone will help get products to market a lot faster. Furthermore, we need to make sure that we can negotiate good prices for Saskatchewan farmers to make sure they get the best price for their products.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
Thank you. I'm not a farmer. I'm a property manager. So I'm going to read stuff instead of actually telling you how I feel, and this is going to be a first for everyone. We want to provide support and recognition for the crucial roles that farmers play as stewards of the land. That is in the same category as First Nations people that believe that Mother Earth is a living entity. Saskatchewan Green Party is the only party right now in Canada that has it in their policies and their bylaws that Mother Earth is a living entity. If we don't look after the planet, you don't have any crops. We provide subsidies for methane reduction feed, eco-agricultural, organic farming, and other environmentally friendly stewardship practices. If we do things more naturally, we create less damage. Again, it's about the wellness of the province. We access land for young farmers so that they can learn from those that have the experience and the knowledge to share from generation to generation. It is a very positive teaching method.
All right, we're going to move on to public services funding. What is your approach to balancing the need for quality public services with the necessity of fiscal restraint? This question will go to you, Mr. Weatherspoon.
Such an important question. Thanks again for this question. It's so very important. It gets to the heart of the other questions around waste and mismanagement. We can't be squandering dollars because we only have one public dollar, and when it's wasted in one area, it's not being deployed into classrooms or into healthcare or into debt reduction or into other infrastructure needs. What we're committed to doing is getting health and education out of last place in this province. We have a government that has decimated education in this province, that has taken per student funding from tops in the nation to last place. Our classrooms are at a breaking point, and the sad reality is that no student is getting what they need and deserve, and that our province will only live up to its potential when every last young person can as well. The same goes for healthcare. We have a government that thinks everything is fine while people languish and lie in emergency rooms that are 350% past capacity, that are losing their lives, and where 200,000 Saskatchewan people don't have access to a family doctor. We need to invest.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
When it comes to public service funding, one thing we need to remember the most is that when it comes to public dollars, they go to public services. They do not go to fund private healthcare initiatives, nor do they go to fund private education. This is not what your tax dollars are for. We would commit to make sure that all tax dollars and public money goes into public services. We would stop funding private healthcare. We would stop funding private education. This is where your dollars need to be. And by doing that, we can make sure that the public sector gets what they need and the needed tools and support without having to worry about cuts or any kind of tax increases.
Thanks, Ms. Bushell. Mr. Rowe, you have 1 minute.
And again, we're talking about public funds. That's your money being given into trust to your employee. This is a job. You're trusting your employee to do what is going to be good for the people. You're giving us the opportunity to actually turn around and transition into a future that is going to be beneficial, not just for the province, but for everyone that lives on this land. It's about being accountable, responsible, and being able to help the next generation plant their roots here and not want to leave because of a dollar. We want to build a family. We want to build a province. We want to build a community. We need to have that money from you in order to build it for your future and the future of the next 7 generations.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
Thank you. And I want to open just by thanking the public service in our province because they do an amazing job, and that includes those in healthcare and education. We have a human resource plan for a very, very aggressive human resource plan for healthcare, and we are monitoring at all the areas within government where we need more public service. We also very much support the collective bargaining process, and although it breaks down from time to time, successful agreements far, far exceed the number of those that are contentious. Most recently, we concluded negotiations with 23 of 38 collective bargaining tables, and this largely goes unnoticed, but we do have one table that has gone to binding arbitration. We need to be competitive when we're at those tables with our public service. We're competing with all provinces and sometimes with the U.S. as well for the quality public service that we need in this province.
Thank you, Ms. Harpower. All right, well, we're going to go back to candidate questions. A reminder, each candidate will be given 20 seconds to ask the question to whomever they choose. That candidate that has been asked will have 40 seconds to respond. The first candidate question will go to Ms. Bushell. You have 20 seconds.
This will go to Minister Harpower. We've seen a lot of initiatives over the year of people wanting to go green. We have seen solar panels being put up across the province. We have seen wind turbines being put up all around. But the one thing that we haven't seen from anyone, and this includes the NDP, is we have not seen a plan of what happens to these products once they've reached their shelf life. What is the plan moving forward to deal with the thousands of solar panels and the wind turbine blades so they don't end up in the ground and actually polluting the earth?
Ms. Harpower, you have 45 seconds.
I'll be perfectly honest with you. It's in discussion. It's not unnoticed that there will come a point in time where decommissioning of the wind turbines and in particular, but also the solar panels need to take place and what program that needs to be. Those discussions are mainly happening within SaskPower.
Thank you, Ms. Harpower. All right, our second candidate-to-candidate question will go to you, Mr. Rowe.
Just call me Trouble.
Trouble.
Good. I'm just Trouble, trust me. And again, Minister, if I can ask you a very good question. You keep talking about these incentive programs, you keep talking about your fiscal responsibility, you keep talking about these aspects of what you're promising yet again, okay? And we can go back even prior to 2002 when your opposition in the legislative right now made similar promises, and yet none
Mr.
have
Rowe,
actually
please ask your question.
came up. How are you going to actually implement them this time and keep your word?
Ms. Harpower, you have 40 seconds to respond.
We did. We have about, I think there's between 32 and 36 incentive programs for the various industries, be that oil, gas, rare earth minerals now has become extremely important for our province. We have agriculture value-added incentive program. So it's been implemented.
Thank you, Ms. Harpower. It is now your turn. Candidate-to-candidate question. You have 20 seconds.
Well, I know Trent would be disappointed if I didn't have another question for him. So due to the flawed accounting methodology used and the blatant ignoring of some of your party's promises in your platform costing document, there's a $3 billion hole unaccounted for. Where will you find the money? Are you going to raise taxes, borrow the money each and every year, or both?
You know, the minister can attack the plan, and I guess that's politics, but the fact is the plan is fully costed and before Saskatchewan people, something we don't have from this government. All we've had time and time again from the Sask party are promises at election time that they've broken afterwards, where they've promised that they aren't going to hike taxes, only to hike taxes in a historic way on the people of Saskatchewan. Our platform is fully costed by a deputy minister that delivered balanced budget after balanced budget, something the Sask party simply can't say for themselves. They've missed their budget targets by $9 billion in the last 4 years, run deficit after deficit, and quadrupled the debt. Just no credibility on these fronts.
Thank you, Mr. Weatherspoon. And it is your turn now, Mr. Weatherspoon, for candidate-to-candidate. You have 20 seconds to ask your question.
I guess my question will go back to Ms. Harpower. With respect to the tax hikes of your government, the biggest tax hike in Saskatchewan's history, of course, that Saskatchewan people are paying now more than $1,000 per year. My question is this: every election, these last two, you've come forward and said you were going to cut taxes and then broke your word and hiked taxes in historic ways, making life so much more expensive for Saskatchewan people. Why did you break your promises?
I don't believe that was a promise to me, but we could go back to those platform documents if you like, just to find this. But I do think sometimes you embellish with your language and what you say. However, let's not just take into account that provincial sales tax has gone up. Yes, we did increase the provincial sales tax. We also increased the number of people in our province. So there's more people paying provincial sales tax than ever before because we have a growing province, and that is important.
Thank you, Ms. Harpower. All right, well, we will get back to our questioning. We're going to talk about long-term financial planning. What measures will you put in place to ensure long-term financial stability and prevent the future budget deficits? We will start with you, Mr. Rowe. 1 minute.
Again, going into what are we going to invest in? Your rate of return is based on the amount that you're going to invest into the people. The people are the ones that actually basically subsidize the entire government. It's your money. We need to invest it wisely and into long-term investments. We need to create manufacturing, and we need to help turn around and create jobs here in this province. We don't need to just export and extract and damage Mother Earth through mineral extractions and oil extractions. We can do something different. We can actually become the central point for renewable resources. Saskatchewan has more sun per day than Germany, and Germany is supplying 135% of their power. You know, we got to change the way we're doing things, otherwise we're only going down the bad rabbit hole. Thank you.
Thank you, Mr. Roy. All right, Ms. Harpower, you have 1 minute.
Thank you. We rely heavily on private sector forecasters for revenue growth and the historical data and the trends for expense growth. So keeping that in mind, only through the economy can we expand services, because services have a cost each and every year, not just one time. There's only 3 significant sources of revenue, and that's taxes, resource revenue, and transfers from the federal government. The caution in order to keep budgets sustainable into the future is do not take very volatile resource revenue and bake it into daily expenses, because governments of all stripes have done that in the past, where the resource revenue goes up, they automatically put it into their day-to-day operating expenses, and then when the resource revenue falls, they're short-handed and they have to do some cuts in order to find that money. So that is my caution going forward. Be very, very careful. Also watch your indicators. What is your debt to GDP? What are the credit rating agencies saying? It's all important.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
Well, clearly we need to stop the waste, mismanagement and corruption of the Sask party, saving dollars. And we need to open the books and review expenditures and the bad deals that have been inked by the Sask party and act to get value for money for Saskatchewan people, building that fiscal foundation that Saskatchewan people can count on, so we can be making the investments in health and education and in affordability in meaningful ways and lasting ways well into the future. We also have to get this economy growing once again. We've had Scott Moe and the Sask party that have stuck us in last place. People deserve jobs and opportunity, and we need to act on those fronts. And we need to ensure accountability and transparency to ensure trust in those choices. But we really have a time right now where we need to get our finances on track and make sure we're delivering value for money.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
So when it comes to future financial management, we have to look at our current state and then move forward from there. One of the most important things we need to do is we need to come up with programs that will pay for themselves. Building homes for people that will be rent to own. These are projects that will pay for themselves. Food security by having greenhouses to sell at market at a lower cost to people so they can have healthy food to live is something that will pay for itself. I posed the question earlier about solar panels and wind turbine blades for a reason. And this is because even though we're told that this is something that's been discussed, this is something that's never been out in the public view. Nobody has actually taken this out to the public and say, hey, what are your ideas? When we could be looking at the public of Saskatchewan and say, give us your ideas. You have the opportunity to build recycling, repurposing companies for these products to make sure that they do not get back into the ground and to also build revenue.
Thank you, Ms. Bushell. All right, we're going to move on to investments in innovation. How will you balance investment in innovation and new technologies with the need to maintain a balanced budget? This question goes to you, Ms. Harpower.
Thank you. Saskatchewan has a very exciting and growing innovation and technology sector. Employment in Saskatchewan's technology sector has grown by over 100% since 2019, where employment grew by 2,631 to 5,489. The Saskatchewan Technology Startup Incentive is one of the most aggressive tax credit programs for technology startups in Canada. The tax credit has supported the creation of more than 440 jobs and has attracted $96 million in private investment. But to ensure that the tax credit is fiscally responsible, the amount is capped every year. And in this budget, the 2024-25 budget, we increased that cap from $3.5 million to $7 million.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
This is a really good and important question. And we're committed to firing up this economy, and we've laid out the Economic Growth Initiative to do just that and to deal with anti-competitive behaviors of the imposition of the PST onto so many sectors. And what we need to recognize is the incredible potential that lies in this province, in every industry, in every corner in this province, and certainly the innovation and also the tech sector are sectors to lean into. Anytime the province is involved, we need to make sure value for money. Importantly, we can't gut education, as we've seen with the Sask Party, because that will hinder our future ability to innovate, as well as will hold back our tech sector. And importantly, we need to connect Saskatchewan with rural and northern internet and cell coverage to unlock incredible economic opportunities for all of Saskatchewan.
Thank you, Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
When it comes to innovation and technology, we've got incredible opportunity. We have got one of the best universities two of the best universities in this country, and one in Saskatoon that really deals with innovation and technology. We've got a tremendous engineering sector that we need to make sure these people have jobs. We need to start relying on the expertise of these people, these students, and these graduates to make sure that we can keep up to date with everything that is going on in the world. But do it in a way to make sure that we are investing in the people of the province, to make sure that there is jobs for these people so we're not outsourcing to other countries. We can look at bringing back the film market. There itself is something that so much technology and innovation is being used, and is something that will bring millions of dollars of revenue into the province. And I think these things are very important.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
Thank you. We're talking about innovation and technologies. Now, this is a really strong point for me. I'm sorry. First of all, we have everything available at our disposal here in this province. We've got Sarcan. You know that most of our plastic goes to Mexico? It actually gets filed down there, it's added to sawdust, and then it's made into composite decking or composite wood, and then shipped back to Canada into Saskatchewan, where Canada is actually the #1 purchaser. Don't you think we could do that here? We start looking at ways that we can reduce, reuse, recycle, upgrade. We could start investing into people on small, low interest corporate loans or business loans to get them going. We take an interest in that. We start building the people up in this province. We start looking at solar home size wind turbines. Stop putting all these mega projects, start putting it onto the homes to save people monies to make things affordable for them.
Thank you, Mr. Rowe.
Thank you.
All right, well, our next question was provided by the Saskatchewan Realtors Association. While recognizing that there are numerous priority areas for each respective party, how will your party make housing a priority while ensuring that Saskatchewan remains fiscally responsible? This question will go to you, Mr. Weatherspoon. You have 1 minute.
Well, this is another really important question asked by the realtors and the home builders here today. Something that we've really been focused on is making sure we're utilizing the assets that have been built and that we're paying for in a way that's prudent and that extends housing to the people of our province. Right now we have a government that's squandering that opportunity and wasting our dollars, sitting on over 3,000 Saskatchewan housing units, if you can imagine, sitting vacant across this province, more than 700 in my hometown of Regina, while people go without housing. This makes no sense. We will deploy those homes and put people in them and secure housing. The other thing we will address is the devastating changes that the Sask Party made to income support that punted Saskatchewan people from their homes, where they took away the ability to pay rent directly to the landlords as well as those utilities. It's caused huge challenge in people's lives as well as more costly services.
Mr. Weatherspoon. Ms. Bushell, you have 1 minute.
People need homes. We are facing a crisis when it comes to homes in Saskatchewan. So many people are in overcrowded rooms, overcrowded houses, and they have no place to go. Many young families cannot realize the dream of owning their first home with the current price that it is. The Progressive Conservative Party Not only would we remove the PST on building materials and labor to make sure these homes can be built to make them more affordable, we are looking at investing. And yes, it'll be initial investment at first, but it's something that will pay for itself. We want to build 5,000 homes over the first 5 years to make sure that people have got homes to live in. These homes will be sustainable. They will pay for themselves because these will be a rent to own. And at the end of the day, the person owns their house.
Thank you, Ms. Bushell. Mr. Rowe, you have 1 minute.
Thank you. So housing is actually part of ending poverty in our platform. And it's very important because you have a lot of poverty, which is why you have a housing issue. Rents are too high, people can't afford them. You can't afford a mortgage. So one of the things that Saskatchewan Greens are talking about is implementing a housing force program, very similar to what's being done right now in Finland. 80% of the participants in house permanently and saves their government in Finland, get this, $21,000 per household per person by reducing the expenditures on emergency services. You're talking about health care? We just dropped it. It's going to help hospitals, and it's going to keep people out of prison. Life is about having dignity when you're living. That is what ending poverty is, and that is what the housing should be.
Thank you, Mr. Rowe. And Ms. Harpower, you have 1 minute.
Thank you. We strongly support the housing industry and the need for housing, quite frankly, which is why we introduced the PST rebate program for moderate to modest housing and the secondary suite program that was spoken about earlier. In the election, we've announced rebringing or reintroducing the home renovation tax credit and also increasing the first-time home buyers tax credit. We are the only province in the country that has a first-time home buyers tax credit. We also have, quite frankly, a income support for low-income workers. That is to help them with their housing costs, as well as there is a rental supplement. We have enhanced those programs through the last few budgets, and we will continue to monitor those programs to help the low income with their rental.
Thank you, Ms. Harpower. All right, well, we're heading into our final question on public accountability. What strategies will you employ to ensure transparency and accountability in budgetary decisions and fiscal management? This question will go first to you, Ms. Bushell.
The first thing we're going to do is make sure those books are opened. We need to know exactly the state that our finances are in the province. Going further from that, once we find out those numbers, which I think are going to be a lot worse than we're currently being told, we are going to make sure that there's a proper audit, and if need be, forensic audit. We will have the books open. If somebody from the public wants to see where are your tax dollars going, we will have no problem showing them. And this is what it means to be accountable and transparency. We're not going to have secret little slush funds that nobody knows where that money's actually going to. And to me, this is very important. We have to be accountable for every single penny that is generated in this province and make sure it's spent wisely and make sure people know where it's going.
Thank you, Ms. Bushell. To you, Mr. Rowe.
Thank you. Again, being accountable to the people is because of the fact that we are employed by you. Keep that in mind. You are the boss. We are just trying to help. We're your voice. So we got to look at the 6 core values of the Saskatchewan Green Party. Those core principles are all about being accountable. They're about being responsible. They're about answering to you. And if you want to see the books, we can open them. You should have the rights to see what is going on and how every penny that you have given into our trust is being spent. The people at the end of this podium think they're the only ones running 61 candidates. The Saskatchewan Green Party has 61 candidates, and we are fully slated to take the next government.
Thank you, Mr. Rowe. Ms. Harpower, you have 1 minute.
The budget is a public document that's open to the public, as well as we report publicly every quarter, so every 3 months, as the budget changes with new forecasts and things that have evolved through the budgetary year. We used to have 2 sets of books under the NDP through the ask of provincial auditors and the NDP, actually. We've gone to summary financial accounting, which then brings other entities underneath our budget so that it is also available for public scrutiny. The official opposition gets to scrutinize the provincial budget numerous hours on the floor of the Assembly through debate and to ask their questions about each and every budget. And of course we have the provincial auditor that audits the provincial budget. They report at year end, so the fourth quarter. And I have to say, I think the value of the provincial auditor's report is extremely important, and people should read that report.
Thank you, Ms. Harpower. Mr. Weatherspoon, you have 1 minute.
We're talking about the least transparent and accountable government in Saskatchewan's history that has wasted no end of hard-earned public dollars through mismanagement, scandal, and corruption. We need to open the books. We need to look at the deals that have been hidden by this government, and we need to act to get value for money on front after front. Again, when a government goes and wastes untold millions or billions, those are dollars that can't be deployed on the priorities of today or to improve our fiscal position. We also need to reform things like freedom of information laws. Right now, this government will provide information to no one and charges fees that are completely unfair. Government needs to be transparent. We need to improve conflict of interest laws, and we need to get big money out of politics, including the out-of-province corporate money that fills the Sask Party coffers, so there's never any question as to who you're working for.
Thank you, Mr. Weatherspoon. All right, well, I want to thank all candidates for a great debate. We are now going to move into closing comments. Now, closing comments were drawn earlier to see who would go first, and the first closing comment goes to you, Mr. Weatherspoon. You have 2.5 minutes.
Well, first, just thank you so much. Lisa, I've been in a couple of these debates the last couple nights, and what a fair and strong moderator. Thanks for your time and investment here. Thanks as well to the Regina Chamber and to Access for hosting us here. And it's been an honor to be on Treaty 4 territory, the homeland of the Métis here at Access in my hometown of Regina, as we look to the future and the kind of province that we want to build, the kind of change that's needed in our province. Let's look at the record. Tax hikes, job losses, business closures, record debt, deficit after deficit after deficit, mismanagement, waste, and sadly even corruption. That's the Sask Party's record. Carla Beck and the Saskatchewan NDP, we have a plan to deliver, a plan to lower costs for people, taking the PST off kids' clothes and groceries, and suspending the fuel tax for Saskatchewan people, 15 cents a litre on day one, saving families money before Christmas. We won't pile on with additional costs and taxes at a time where people can least afford it as they face a once-in-a-generation cost of living challenge, as we've seen with the Sask Party. And unlike the Sask Party, we won't deny the hardship that they're facing. That's why we've listened to them and why we've pushed for relief day in and day out. We'll also make sure we have a plan that goes further than just saving you money. It's a plan that'll fire up jobs and investment and strengthen our economy. We have an investment that we'll make to make sure that we act to make our communities safer. In our plan, we'll bring the budget back to balance in the first term. We're going to make the investments to get us out of last place in healthcare, education, and affordability. And we have a fiscal plan to put our dollars where they're needed, not to waste them. This election, don't settle. This election, vote for change. Vote for a record you can trust in a plan that will get the services and the things we count on back on track, and that will build a future filled with hope and opportunity. A Saskatchewan that works for everyone. I humbly request that you vote for Carla Beck and the Saskatchewan NDP. Let's build Saskatchewan together.
Thank you, Mr. Weatherspoon. All right, Ms. Harpower, you drew second. You have 2.5 minutes.
Thank you. Thank you to the Regina Chamber and you as well, Lisa, for being a great host. Thank you to Access and the home builders and the realtors. The Saskatchewan Party has a plan to keep our economy strong and our future bright. And through a growing economy and strong fiscal management, the Saskatchewan Party will keep investing in things that matter to you. There are 69 new schools in Saskatchewan, either built or being built. Almost 21,000 kilometers of highways has been upgraded or repaired. We have built 4 new hospitals and a brand new urgent care center right here in Regina. We have come a very long way from the days of decline, loss, and closure under the NDP, where our net debt to GDP ratio was 78% higher under the NDP than it is today. A re-elected Saskatchewan Party government will continue to deliver our plan for growth. There are 250,000 more people living in our province today when compared to 2007. There are nearly 100,000 more jobs in Saskatchewan today. Right now in Saskatchewan, we're growing at the fastest pace in more than a century. The Saskatchewan Party will keep our economy strong and our future bright. I humbly ask for your support for the Saskatchewan Party, and thank you for listening tonight.
Thank you, Ms. Harpower. All right, Ms. Bushel, you are ready for closing comments. You have 2.5 minutes.
Well, first I'd like to thank Access, the Chamber and you as well, Lisa, for doing this for the past 2 nights. They have definitely been an experience. That's something that I'm going to say I haven't done before tonight. So it has been really good, and all of you have made this process a whole lot easier. But we're looking at 17 years. In 2007, our provincial debt was at $9 billion. When the Sask Party took over in 2007 to now, so that's 17 years, that debt has now ballooned to over $30 billion. That is an increase of $21 billion in 17 years, which is an incredible $1.23 billion per year. This is something that the Sask Party cannot blame COVID on. This was going on, and this has been a progression for the full 17 years. They say that they've balanced more than one budget. They say it's 3. I'd like to see that auditor's report to see that. They had actually last year boasted a surplus of $1 billion, which turned into a $250,000 deficit. Where did that money go? That's not a balanced budget. That is a deficit. Progressive Conservative people in the legislature will really work and advocate for people to make sure that your voice is being heard, to make sure your dollars are being spent wisely, to make sure that those books are opened so we can actually correct the mistakes of the past. We will keep government held to account to make sure there is no overspending, cancel mega projects until this is actually done. Until this is done, until we get our finances in order, these mega projects can't go on. This is a wasteful use of your taxpayers' dollars.
Thank you, Ms. Bushel. Mr. Rowe, it is time for your closing comments. You have 2.5 minutes.
Thank you so much. I want to thank everybody that's here because this has been a brand new experience for me. I've done a lot of things in my life, but this is the first time I've actually today done my first televised debate. So I really appreciate all the support that we receive from everybody. And again, it's nice to share our knowledge and information with you, the voters. It's your voice. So yes, first thing I'm going to do is say, look back in history, go back 50 years. Tell me what parties have brought you into this rut that we are in today. They keep following the same path over and over and over again, and they made this rut so deep that you actually need scaffolding to get out of it. We are the change. We are guided by elders from the Sovereign Indigenous Peoples Advisory Council who are actually helping to guide the policies to help save the planet for the next 7 generations. We have 61 candidates on the slate. Don't believe that they are the only 2 choices around. We can form government, and we can make that change. The only thing that we need is you, your vote, and your hope and trust in us to do what is right for tomorrow, to be held accountable for your money. This is a job, not a glorified paycheck. This is about the people of Saskatchewan, in the province of Saskatchewan, for Saskatchewan. And it's about working together and building something new for the future. It's about being sustainable, self-sufficient, and healthy in a well-balanced lifestyle. I thank you very much for allowing me to vent my anger sometimes, but after 63 years of seeing what's been going on in this country, and especially in this province since 2002, enough is enough. I said everybody gets 20 minutes. Well, I'm sorry to say to the NDP and the Sask Party, your 20 minutes is up. It's our turn. It's our chance to actually make a difference. Thank you.
Thank you, Mr. Rowe. All right, well, that brings our debate to a close. I want to thank each of you, the panelists, for bringing your passion to the democratic process. Democracy is a wonderful, wonderful privilege, and we hope that you exercise the freedom by casting a ballot on October 28th. From all of us here at Access Communications, thank you for watching tonight.
If you'd like to share your feedback on the program you just watched, contact us today